Right now, welcome to Medianama's first online roundtable. I hope all of you are well and safe, uh, and and thanks for joining in. So this is many of you come for our offline discussions, and we've always tried to have an open discussion, walking around, talking to people, bring and getting multiple points of view. We're trying to transpose that format of the physical discussion to the web. So uh, bear with us as we try to make this work. May not be as streamlined, but please do let us know and give us feedback post the discussion. This discussion was supposed to be under Chatham House, but there was a request from some people in government for this to, because they're not allowed to use Zoom, for this to be live streamed. So we are live streaming on YouTube, and it's not possible for us to maintain Chatham House in those circumstances. So all comments are effectively on record. We'd like to thank the Internet Society, ISOC, that is Google, Facebook, and CCG at the National Law University, Delhi, for the support for this discussion. We have a few people on board as panelists for the initial remarks and comments that we'll be turning to, and because in that roundtable format. But at any point in time, if any of you would like to ask a question, please use the Q&A module on your Zoom app and ask a question there. If you'd like to interject or make a point, please use the virtual hand raising option. And just to begin with, everyone's to prevent any background noise and to prevent Zoom bombing, everyone's muted and on listen only mode. But as you start commenting, we will bring you into the discussion. Um, we're making sure no one can share their screen either. I don't. Zoom bombing's been pretty common of late. So we have someone who's managing the call who will unmute you. And when if you're not speaking, I'd request everyone to please put themselves on mute and interject by physically raising their hand so that we can spot you. This discussion is essentially divided into three parts. We have Mr. Amar Patnaik, MP in the Rajya Sabha from the Biju Janata Dal, who's also a member of the Joint Parliamentary Committee on the PDP bill, joining us. We had a fantastic conversation with Mr. Patnaik just before the lockdown, and that discussion's up on YouTube. We spoke for over an hour about varying aspects of privacy, and he will be delivering the opening remarks from his experience as a legislator from Odisha, um, uh, and about the current situation and about privacy. Post that, we will begin the roundtable. The roundtable is split into two halves. In the first half, we'd like to examine the state of exception and the impact of the COVID-19 pandemic on privacy. In the second hour, we'd like to examine the kind of norms that can be created for preserving privacy during and post the crisis, and where law and where in law those norms may be vested, if at all. I'm particularly interested in norms and principles around dismantling, the data sharing and power structures that have been created for the state of exception. And we also need to look at how we'll come out of this from a privacy perspective, apart from how we are in this right now. Um, one thing is that I don't want this discussion to focus too much on Arogya Setu and contact tracing, and focus on larger concerns around privacy, because we've had those conversations and we've done interviews, including with Rahul, who's Rahul Matan, who's joining us for this webinar, and they will be available on YouTube, on our YouTube channel soon. Aditi and I'll be moderating this discussion. I've had a bit of a mishap with my internet connection a little while back, so if either of us drops off, the other will take over. And with that, I'd like to invite Mr. Patnaik to make some uh, opening remarks and give us a sense of what he's seeing from a privacy perspective. Mr. Patnaik.
Thank you, Nikhil, and thank you everybody who is here in the meeting, the virtual meeting, and thank you, Aditi, too. You see, I thought I had been watching the response the state government has the Orissa government of Orissa and the government of India have had to the COVID-19. In fact, I was in the parliament when these statements were being read out by the health minister relating to our preparedness for COVID. Two statements were made, and then we suddenly closed down, and that was the last day after which the lockdown was enforced. You see, I think the most important thing that we have to understand in this fight is that a lot of things are not known about this epidemic. A lot of things are not known to the medical fraternity, to the policy planners who have to respond to this pandemic, and also a lot of things are unknown as to what would be the behavior of this virus now or after 14 days or even after 28 days. And even more importantly, is there an antibody regime which is being developed within the body after you have had a bout, or you are still susceptible to have another wave of or another bout of corona, in which case you'll have another wave. Now, given these uncertainties, this is the context. The state governments as well as the central government are, I think, responding to this situation in a very dynamic manner, as it should be. They're changing every 2 days or maybe 3 days, and I see it in my state itself. Honorable Chief Minister Naveen Patnaik and his team of officers and our people who are in regular touch with the government of India, they have been studying the situation from almost on a daily basis, because you see, we took a decision, things were running pretty normal, then suddenly we had the Tablighi numbers coming up in Orissa. Then we had to suddenly change our decision. We imposed a lockdown in Bhubaneswar and Cuttack and Bhadrak for 48 hours, complete lockdown within the lockdown period. And then again, we did another 5 days of lockdown suddenly from in 3 districts because of the migrant laborers from Calcutta coming in, and we had some incidences there. So the things are changing too much. Now, given this context, I thought I would just start with the Puttaswamy's judgment. Puttaswamy wants, because the question now is, what is the balance between data protection and public health? I think that's the point that's going to be the main theme of the issue that will be coming up, that has come up now, will come up probably and will continue to remain so for a long period of time. Now, he says that the state may assert a legitimate interest in analyzing data born from hospital records to understand and deal with a public health epidemic. If the state preserves the anonymity of the individual, it could legitimately assert a valid state interest in the preservation of public health to design appropriate policy interventions on the basis of the data available to it. That's in Puttaswamy 1. Now, if this is going to be the guiding principle, and given the context that I have mentioned, what I thought is important to mention that from the point of view of containing and managing a disease, it is nothing new that we are doing in terms of surveillance strategy if we are adopting a kind of a surveillance strategy. We did it for malaria, we did it for TB. So in India, we have something called as the Integrated Disease Surveillance Program, the IDSP, and the National Disease Control Program. And the health minister did say, I think on the 5th or the 6th, or probably the 10th day of the press conference, that we are going to follow that model in trying to exercise surveillance so as to contain the epidemic. I am not talking about the social distancing measures that have taken place. That's separate. That's the strategy that we have followed. But despite the social distancing, despite the hand washing, despite all the precautions that is required to be taken, there's still positive cases. And if those positive cases come up, then we have to ensure that the infection, as we saw that the infection is very infectious, is a contagion, so it has to be limited. And therefore, data which is coming from the only sources that data is that particular patient, positive patient. Now, if we have data from that patient, how it is going to be used or utilized to contain the spread of the disease, spread of the pandemic in a particular area, in a particular city, in a particular town. And so I will raise, actually, I'll carry on this for a little more, and before I raise some questions. Now, when you would do this, we have seen this point that we opened the containment area once in a particular locality in Bhubaneswar, because we thought that we had sorted that out. But suddenly there was a case which came up, because you see in India 80% of the cases have been reported as asymptomatic. So you really do not know when to shut down and when to actually open up. And after opening up, again, if there is a incidence, then again you have to contain it. We have faced those situations. Now, in these circumstances, surveillance is definitely necessary. But the question is, how long? Now, how long is the surveillance going to be there? Now, that question, again, very difficult to answer, because there is no guarantee that if somebody has already had a case, then he will not be infected again. There is no guarantee that, if the person is infected now, he will not be infected after probably 3 months again. People say that it changes with temperature in October, it might again come up. So you do not know when his data should be erased. These are this is relating to the patient. Now, patient's information. Now, how quickly or how best, without intrusion, the least intrusion into his privacy, you can collect this data. Now, these are some questions that you can always ask. But given a situation like this, when you do not really have a strategy in place, unfortunately, in IT systems, when I was a bureaucrat, I used to audit IT systems. We have, what is called as disaster recovery and business continuity plans. You have BCPs, and we test them from time to time. Now, here we do not really have something like that. We only have that program, disease surveillance program. We have a health infrastructure. In some places, it is rickety. So that's why we are doing lockdown. That's why we're doing social distancing. But in terms of list, the data which is, in terms of the purpose, the limitation of purpose or limitation of collection, what is the minimum data that is required? I can't say it, actually. Even the health secretary or the policy planner cannot say it, because the medical fraternity is still debating what is important and what is not important. Of course, and data, something which is totally grossly not related to the thing, will not be required. But if you collect some information, let's say a person's name, then his contact, his parents' name, his relatives' names, where he has gone, where he has visited, I see a legitimate state interest in this. Now, you would ask whether it is backed up by a regulation or by a law. Now, what the governments have done, they have reverted back to the Epidemic Diseases Act, as we know, and the Disaster Management Act. They have brought in a COVID regulation. They have made the regulation provisions very stringent for those people who are violating the lockdown. They've increased the amount of penalty, as well as the jail term, with the hope that it will deter people from coming out. So that is the regulation that they have backed up. Now, whether it is proportionate or not, that's the point where I said whether it is proportionate or not is very difficult for me to answer, because let me tell you, in a particular containment zone in Bhubaneswar, until that time, it was, I think, the 7th or the 8th case, we had not divulged the name of the patient or the infected person. We were not. It was completely anonymized, whatever the data, it was with the government. But on the 7th or the 8th patient, we had to divulge the name of the person. Why? Because reasonable amount, all practical, all reasonable methods of contact tracing failed. So we had to divulge his name, in which case suddenly people started coming out from his colonies who he had interacted with. And then we realized that his daughter was not revealing the fact that she had not told anybody in the house when she had gone to Calcutta and had come back. So, there the question would again come, whether it was justified. I know in Karnataka, in some states, they're divulging the names of all the patients. Here, we had not done that. So which is right? Now, these are questions which are very difficult to answer, because you have to respond at a particular point of time. In our state also, after that incident, we have not divulged any more names, even though there are about 101, 107, I think, positive cases now. Very interestingly, in the case of the Tablighi Jamaat fellows who had come here, the people who had registered that they had come from outside, we have got a platform which registers people who come from outside. There were only about 28 people, but we knew there were more. Now, some states and in countries, they have followed the drone, they have followed many other methodologies to find out who they had interacted with. In our state, this chief minister followed a simple, made a simple statement or a video message. He said that I'll take care of you, don't worry. You please come and self-register yourself. And 43 of them self-registered. So what method will work, what method will not work is actually very, very difficult to say at this point of time until we sit down with this data and analyze. Now, someone today, for example, says that 85%, there is, of course, 85% strong correlation between temperature and all this. Now, if that is the thing, someone can say that in these areas, which are hotter areas, you shouldn't have taken so much of information, and in colder areas, you should have taken more information because the infrastructure, the health infrastructure to cope with that may not have been there. So it's so my take on this is whether we should actually, there is, I was writing a piece whether the Epidemic Diseases Act and the Disaster Management Act are sufficient, or we need to have a separate act for disease surveillance in the country. In any case, in the Personal Data Protection Bill, there is no element of surveillance in it. The data, how to protect the data is there, but the data being used by government for surveillance or by anybody for surveillance and monitoring, that portion, that aspect is not really covered. We don't have a surveillance act. Now, at least if you look at sectorally, then we could have in the health sector, maybe there is a need, that's one thing, whether it is necessary. The second aspect which I would require is what is important. Both are under the right to life, right to privacy, Article 21, and right to life is Article 21. Now, which is important, whether the privacy of one individual person or the life of a full community of people in which he is staying. Mind you, there are people who are not telling because of the stigmatization that has come to be attached to it. They're not telling, they're not revealing that they are having any kind of symptoms. In any case, it is asymptomatic. In any case, 80% of it is asymptomatic, so you can treat the trend as asymptomatic. So in that case, a government of the day, what should they be doing? Shouldn't it be completely exempt on the Section 12 anyway? They can take the exemption, but for how long? Whether how much is proportionate? What is the minimum data? Beyond that, it is not required. Whether it needs to be specified completely to the patient. Now, these are questions. Now, there is a thought which is there. I think the European Union has done in whatever is happening in UK, that they have said that no, despite the pandemic, the basic principles of data protection have to be respected, and therefore the principles of having a law in place, the principle of seeking minimum amount of data to tell the patient that what it is going to be used for, the specific purpose it is going to be used for. Similar such things have to be mentioned. We in our country or in our states, it is assumed that the information that is being collected will be utilized only for this purpose by the governments. But what happens if there is a leakage? What happens if somebody else, because now private, when we fortunately haven't had really large numbers, but if you really get numbers in May and June and people have to also go to private hospitals, in that case, there could be the same data could be leaked out to people outside. So what is the kind of control, or what's the kind of control we must have on that? And therefore, to cover all these things, is it necessary to have a separate Disease Surveillance Act? That's something I think which we should debate. On the application, since Nikhil said that we are not really getting into the Arogya Setu, there are many the ideas, the questions about it not being open sourced and whether the data is sufficiently anonymized. You see, the anonymization of data has been exempt. It's not necessary if you're doing research. Now, the kind of thing that we are in, someone can argue actually that the medical fraternity is actually continuously doing research on this data. So how much of anonymization can you do? And if you do too much of anonymization, is that data of any use? I can understand the anonymized data is useful for deciding which one will be the containment zone, which one will be the place. Let's say in our state, we have hospitals in every district, separate COVID hospitals to avoid cross-contamination with the normal patients, and therefore we have fewer hospitals separately. Now here, this resource allocation would not be an issue, but we have the big hospitals where people need ventilators. Then there are actually in Cuttack and Bhubaneswar, so the patients have to be brought in over there. But for that, you have to know the patient's name. You have to know which area is he in, what is his medical condition, and then you have to treat accordingly. Now the question here is that is the security systems in place, data security systems are in place to avoid any future misuse that can happen or harm to the person that can happen. And very frankly, we can't talk about this at this point of time because people are now here responding to a situation which is just keeps on changing. Now the migrant laborers are going to come. I'm sure all over the state, all over the country, in every state, there will be a very different kind of situation once the migrant laborers come, because you see, they have not been tested there. They have not been tested in the state in which they've been working. They have been brought here, and they have been brought to the villages. And Orissa, what we have done is that we have given the power to the community. The community surveillance, the sarpanches have been given the power of the collector, and they would be enforcing the quarantine and isolation and the checking of these people. I don't know whether the other states are going to do it or not. And even after doing that, this is happening at the sarpanch level. Data is going to be collected at that level. So if you are collecting data at that level, what kind of protection mechanism do you expect to be followed? And in case there are breaches, who will be settling it when it is happening at a local level? These are some questions which will again come. I think these are the issues. I'll finish it. Thank
you. Thank you, sir. So we'll begin the roundtable discussion. I was wondering, Malvika, Raghavan, if you would like to respond to some of the things that Mr. Patnaik had said, and perhaps also go into the history, or perhaps some in the past, how has surveillance been linked to diseases, and what sort of privacy norms have we seen in those cases in the past?
Okay, thank you, Nikhil, and thanks for having me. And it was great to hear your comments, sir. Thank you. Well, I suppose to just kick off and respond to those questions, I want to highlight one thing and just say that I would like to stress that we are in a public health emergency. It's stating the obvious, but I think my concern in the last few weeks is that our focus, even as a tech policy community, on a public health response and a pandemic preparedness response is not being as starkly framed. It's often becoming a national security conversation or some other kind of surveillance conversation. So I just like to frame, I think ultimately for a public health crisis, you need a public health response, and to some extent technology or data can only assist that response, and obviously that's stating the obvious. But I think one thing that the Honorable MP did state was about that Chief Minister's speech, right? And that really stood out to me. I think, and the reporting that followed that, and the 43 people who came out following that as being positive for COVID, I think it also highlights the importance of effective public health strategies to build trust. Because I think ultimately in this kind of a public health scenario, when you have a crisis, what are the kind of strategies that can build trust? I think coercion creates further instability, and I think it has all these strange incentives when it comes to human behavior, especially when it says something as sensitive as testing positive to a highly communicable disease. So to that extent, that's just my kind of framing comments. I was hoping to do 3 things, and I'll try and do them quickly. Firstly, I thought, obviously, I'm not a health expert, and we don't have that much, as a country, I think that much experience with this. I understand the Epidemic Diseases Act was when the bubonic plague happened in the late 19th century. So clearly we are a little low on experience, but I think there's something from the HIV/AIDS success story that I take a lot of heart from, including on the kind of strategic information management there. And the 2 other things I was hoping to pick up on was just what can we think about if we are in some kind of a health emergency? Are there some common governing principles we can start thinking about for all rights, including privacy? Because obviously that's something close to this community's heart. And then I'm curious to hear from other people. On the AIDS story, I think And there are a couple others, we discussed, I think previously, we thought about smallpox and how the Indian government has evolved from smallpox stage until the HIV AIDS response. I think that was probably the closest pandemic we've had as a global community. And I think there the response was a set of targeted interventions and also a set of treatment promotion, right? So the focus was really on blood safety testing and counseling, including management of STIs and so on. So there was a public health element. There was also targeted testing, widespread testing element in kind of hotspots, and a strategic information management system, as well as a regulatory apparatus that went along with that. I'm not saying we need to create a new apparatus to deal with this, but I think it showed a kind of long-term view. And as a citizen looking at the government, what I think I'm curious about is what is the long-term view here? Because it seems like ultimately we're holding the fort until a vaccine is formed. So to me, this is a temporary situation of unknowingness. In 6 months from now, I think if nothing, we will know something more about this virus. If nothing, we will know something more about where we are with the vaccine. So really, how are we, this is an interim period, and then ultimately, how are we going to deal with things that I think about very often in my work and financial inclusion? And sorry, I forgot to introduce myself. I'm Malavika Raghavan. I work on financial inclusion and tech policy issues at Dwara Research for the Future of Finance Initiative. And there we are really worried about MSMEs, personal livelihoods, migrants, low-income workers, and so on. So given this frame, I think this information conversation is kind of until vaccine. And I think in that situation, in that kind of time span, I think the second part of what I want to say was about what are the governing principles here. So sure, we might be in a health emergency or a health crisis. I understand, this is some kind of a state of exception where many of our laws are being suspended and many of our human rights that we would normally have are being, I suppose, derogated from to a degree. And I think there are about 3 or 4 things I'd like to say. First of all, I think there's a common misconception that a state of emergency or exception displaces all rule of law. I think if you're a constitutional democracy, ultimately the idea is in any state of emergency, what do we commonly agree are the principles that we use or the rule of law we agree to in that state. And so if we are in a public health emergency, again, going back to trust and coercion, kind of where do we draw the line in order to get to the public health outcomes we want? There, I think, kind of going back to things like the HIV/AIDS story or the polio story, there are some clear things which emerge, and I'm curious to hear the rest of the panel's thoughts, the roundtable's thoughts. Firstly, I think just if you're democratic, then essentially you're thinking about freedom and an ability to participate in public affairs, elections, and so on, and having a non-arbitrary state, and having some kind of checks and balances on this heightened executive power that we now have. Essentially, we have agreed to give executive power to our government and police force in order to, safeguard public health. I think for any rights, especially privacy, there are several touchstones that we've had now that we have vested this kind of enhanced executive power through a legislative emergency, or, it's not a constitutional emergency. I think it's definitely some kind of legislatively enhanced executive power. There, I think, proportionality, and I think, sir, you did say this as well, proportionality is really the touchstone. I think again and again, we have guidance in our jurisprudence. Is it compatible? We have to think about purpose. Just because information is available, I think not having the public health framing can be deeply dangerous. Health information for public health for COVID, can you get to this with less intrusive means? Can you have a relationship between that individual and the public trust that it's always tested against? And
Malvika,
yeah.
we wanted to get to the interventions or the changes in the second session after an hour.
Yeah.
So could you hold that thought for now, and then we can move to that. So I wanted to bring in Malavika Jayaraman, who's joining us from Singapore. Malvika Jayaraman, sorry, who's joining us from Singapore. Malvika, what are the trends that you've noticed in terms of how civil society and citizens have responded to the privacy incursions during the pandemic in Southeast Asia, since you look at that from a Digital Asia Hub perspective?
Yeah. Hi, thanks. Can you hear me, Nikhil and everyone?
Loud and clear.
Yeah, okay, great. Thank you. For all its faults, at least I know we have a good internet connection here, so that helps. So sorry for dazzling you with an overly artificial background. It's the most I can do to cheer myself up in these horrible times. And so you also don't see the mess in my background. It's not often I get to speak at an event where there are two Malavikas, so that's also interesting for me. Hi, everyone. So I think some of the trends that I'm seeing are, I would club them under this sort of broad theme of never waste a crisis, right? It's if you can possibly push through an emergency power, this would be the best time. If you could possibly cut down on civil society meeting, assembling in any kind of meaningful way towards protests, this is a great time. If you really don't like what the media says about you, especially independent media, this is the time to release FIRs against them, even if you have to travel very far in the face of social distancing measures to do that. This is a great time to do that. So I think there's very much this sense of things that would be completely egregious under any other circumstances. The assumption is that everyone is asleep at the wheel and you can push through things that would be completely unconstitutional and ridiculous and that would have absolutely no public support. And I think the other thing I should mention is also the misinformation is strong in this one for those who are Star Trek fans. So I think those are sort of the clusters of things that I'm seeing a lot of. And this is actually not a legal or an ethical issue, but it's a very practical issue that civil society is facing even more constraints against funding than it always has, right? First of all, you've had the very debilitating effect of the economy shrinking. You've had a lot of grassroots activities that focus on events, that focus on field work, that focus on in-person movement. All of that is wiped out. And I think accessibility is the other big thing that's at stake, because you really have two pandemics, right? You have one that affects people who are worrying about how to make sourdough bread and, you know, whether they can get back to their Pilates classes online rather than in person. And there are people wondering how to get home and walk 300 kilometers just to get food, right? So there are parallel pandemics. And I know that in the privacy sphere, we have a very, very strong link to literature. We're always mentioning something being Orwellian or Kafkaesque. We have the Brave New World. We have, you know, we co-opt literature whenever we can. It's not often that I get to bring up the Scarlet Letter or A Tale of Two Cities, but that's where we are right now, possibly even A Handmaid's Tale. So I think those are kinds of the trends that I see across the region. And the other one is where I think there's a lot of public-private partnerships that have been accelerated, and private-private partnerships. You'd never see Apple and Google cooperate on anything, right? Suddenly they're willing to in the face of a pandemic. And that might be great if it's a product that actually is more privacy preserving than others. But we've really got to worry about consolidation, right? Even people who study competition and antitrust like Tim Wu are saying this makes every other anti-competitive move towards consolidation like Mickey Mouse compared to everything else that we've seen previously. So I think finally, I'll just say that the move towards harnessing telecoms data, I mean, I think when you think of disease surveillance, you have passive surveillance and active, right? From a sort of public health perspective, passive is where hospitals and public health institutions are voluntarily sharing data with the government when they need to. Active is when government aggressively goes after not just the healthcare providers, but telecommunications providers, technology service companies, anybody that might have access to any kind of big database and actively pulls that data. So it's not push, it's pull. And I'm seeing a lot of that across the region as well. There are measures that are trying to insert checks and balances, like Professor Lillian Edwards' bill for coronavirus safeguards that was just tabled in Parliament in the UK. There was a hearing yesterday, and there are other people trying to copy sections of that bill, particularly in terms of immunity passports, ways that you can prove that you're okay, right? Similar to the traffic light system that you see in China. And again, things that are being implemented as a sort of either a traffic light system or a very binary system of enter or don't enter, allowed to do this or not allowed to do this, which I think has extremely long-term implications. And these are systems that are very easy to push through at the time of a crisis and extremely hard to dismantle. So it's not just the question of, you know, the data genie being out of the bottle. It's also the question of systems of structural inequality, systems of discrimination, systems of oppression that have existed historically that have amplified inequality and digital divides, actual illiteracy, sanitation, water, health, housing, all of these things are at stake in a way that we've never seen. So I think privacy is very central to all of these discussions. And I think it's something that we're focused on in this roundtable, but it's by no means the only human right that's affected. And I think to frame it in the sense of a trade-off or a balancing act is extremely disingenuous, right? It's a sliding scale, it's a spectrum. It's not a binary, it's not a zero-sum game. It's extremely complex and nuanced. You have to deal with things like autonomy, assembly, religious freedom, minorities, accessibility. You've got all kinds of human rights, that right to food, all kinds of things that are implicated. So I think this is, again, like just a crisis beyond anything we've seen before.
Malvika, so here I would like to know from you if there are particular trends you have seen in terms of response from, say, the civil society or from people at large. If, for instance, people in South Asia or in Asia at large have been far more receptive to surveillance related to pandemic than, say, people in Western Europe. And if that has led to tangible change in the resolutions passed. You mentioned a bill by Professor Lillian Edwards. So if you could talk a bit about it.
Yeah, so on the civil society aspect, I think one thing that's been very instrumental and helpful is the number of organizations, particularly those with some technical capability, that are pushing for a lot of the contact tracing and other techno-social apps that are being used to manage the crisis, for them to be open source, for them to be auditable and transparent in different ways, and to put them up for other people to vet them. So I think that's something that civil society is pushing with a lot of success in the region. It doesn't mean they're getting access to everything, like the Trace Together app in Singapore. People are querying it and saying, yes, it's decrypted, yes, it's on your phone, yes, it's allegedly open source, but it's the protocol that's open source, not all of the source code. So I'm seeing a lot of initiatives that are actually pushing for this to be made more transparent. And for the bill that you mentioned, it's called the Coronavirus Safeguards Bill 2020. So it's about proposed protections for digital interventions and in relation to immunity certificates, which was just published on the 21st of April. And it's basically providing safeguards in relation to symptom tracking and contact tracing apps. It prescribes minimum safeguards if they move towards immunity certificates. It doesn't try to duplicate things like the GDPR or the e-privacy directive. It's technology neutral. It doesn't mandate any particular approach to building them, but it talks about the digitally excluded to ensure that the apps that are being rolled out don't further entrench their exclusion. It talks about confidence that data will not be misused, repurposed, or shared to the private sector, like insurers, marketers, employers. It talks about the role of consent. So it basically is, it's kind of like a measure to protect against digital divide issues, where you will not be penalized for not having a phone, for failing to charge your phone, leave the house without a phone. It doesn't compel you to install a system or to share status messages. If you are required to, it has to be transparent, legitimate, necessity, proportionality tests have to be alluded to. It shouldn't be shared beyond the NHS in the case of the UK, unless it's securely anonymized. The personal data should be deleted and anonymized as soon as possible. No sanctions if you fail to carry these devices. It talks about data protection impact assessments, complaint, oversights, review, interpretation, all kinds of things. So I'll just leave it there, and thanks for sharing the link. So yeah, I would really love to hear from everyone else, unless you have anything further for me.
Right. Would it be all right, Nikhil? There's Dave Lewis from China here. Who can...
Just before that, Aditi, I'd like to bring in Mr. Bajpai. Mr. Sunil Bajpai is here. He raised his hand. Sir, would you have something to say? You're on mute, sir. If you could just unmute. Sir, still can't hear you. Yes.
Now I hope you can.
Yes, sir. You can.
Sorry, one uses so many of these apps that you forget which one unmutes which way. Sorry about that. And I actually would like to thank Mr. Patnaik for a very nuanced statement and for outlining the difficulties that that COVID-19 presents. A lot is known about this virus, but much less than what we would like to know. People are trying out ideas and developing strategies in real time, whether it's that PACT protocol of MIT, the Trace Together app built on that, and the Indian Arogya Setu app, all of those kind of efforts. Now they have to be allowed to work without everyone constantly badgering them with questions. You know, lawyers, activists, their own bosses, Twitter experts, everyone is asking, why are you doing this? This is a risk here, that is a risk. So could we consider that they be allowed to make their decisions today? The policymakers, the administrators, the people who are building these apps, that they be allowed to make their decisions today, but that everything should be declassified at a later date so that all stakeholders can learn from the experience. That would be the time to debate and to fix things up for the future. That would also be the time to examine. And I mean, people who are taking decisions today would know that their decisions may come up for a debate later on, and I will have to defend myself.
So,
That's
if I
why-
may, Rahul Matan is also on this in this discussion,
Yeah.
and he has said that the feedback that was received on the initial privacy policy for Arogya Setu has helped in improving and sharpening and addressing some of the concerns. So I don't think it's really incorrect or there's a misgiving that we shouldn't be questioning
No, I didn't say that we should
or we
not
shouldn't be asking for improvements in the steps being taken, I think.
No, that's all right. You can question and you can engage to help
Yes, sir.
refine it. And I saw your write-up about what could be done to improve this app. But full and complete information must be there. All decisions must be carefully thought out. That I think is a little difficult at this moment because the numbers are rising every day, and something needs to be done to save lives. That's the limited point that I was making, and I thought Mr. Patnaik would be a person to consider it because he's
Mr. Patnaik, you're on mute. I think Mr. Patnaik was trying to say something.
Okay.
What Mr. Bajpayee was saying, I think both of you are actually that you're not saying different things. What probably he's trying to say is that the response is so dynamic, and it is so it is required to be dynamic that it will remain that way. And the proportionality, basically, the question is how much is proportionate? The infringement into the data privacy, how much is proportionate? That cannot be freezed at a particular point of time. Probably it changes from time to time. And the suggestions that you are giving also real time, whatever is coming from outside, it probably is getting fed also into the strategy that is changing dynamically. So I think both the things should happen. But what he says that later on the data be declassified, I think the more important than declassification is that the purpose for which the data is being taken, that should be mentioned, which people I think know, but that should be clearly mentioned and utilized for research so that in next bout of epidemic, maybe of the same disease, we do not make such mistakes.
And operating the way the decisions were made, all of these things need to be debated, sure. And all of these should include not simply the data. Everything can be debated later. That's what I, in a limited way, I wanted to suggest.
Got it, sir. We just like to invite Dave Lewis, who's also joining us, just for the perspective on what's happening in Southeast Asia and China. Dave, would you like to tell us about what you're observing in terms of just what's happening in terms of privacy, in terms of initiatives being taken by various governments? Dave, you're on mute.
Yep. Thank you, Nikhil, and thanks everyone. It's been an interesting discussion so far. Yeah, I've been based in Shanghai since the beginning of the outbreak in January up until now, and the technology and surveillance story has pretty much been a very core part of life here, right from the start. So, I mean, since about mid-February, when China began to transition away from the lockdown, right, the major objective became to restart the economy, to get migrants back into the cities, which is the same issues that seems like India is sort of at the precipice right now, approaching May and June. And the one sort of core feature that has been a big part is the health code, or the health passport that Malvika also alluded to in her address. And this health code has now basically become a new form of identity that regulates everyone's access and entry into cities. It regulates domestic travel. It regulates who is allowed to go back to work, whether it's factories or even white collar in offices. It regulates your access to typically large sort of gatherings of high density of people, gyms, malls. And the implementation is not uniform. So I know this tends to be an idea that, in China, overnight, the entire country sort of steps in unison, but it's not really happening in that way. It's very decentralized. So each city, and there's about 200 different cities across the country that have essentially created their own version of a health code. And so based on data that different local government departments in those cities have been able to put together under a platform, they've created these codes that govern what people can and can't do in those cities. Now, I've been observing the sort of Chinese and Indian internet space for a few years now, and sadly, the amount of comparisons that I can make between what happens in India is just increasing with alarming frequency. And reading about Aragya Setu's sort of decision to bring in some of the sort of similar green traffic light signal is also alarming. But I think I find it difficult to see how India can really look at the sort of Chinese health code as a model, because one of the big differences is that this code really sits on a larger techno-legal infrastructure that China has been building now for the last few years, which is just not comparable with India, both the political system as well as the sort of techno infrastructure that's supporting it. So I would say the two big things are, one, the real name ID registration system. In China, everyone's phone is linked to a real name ID. And therefore, China already had an existing infrastructure where everyone's internet interaction, every app you downloaded, what you posted online was linked to a real name ID. So this data was already there. It existed. Now, over on top of that, the health code has been developed by both tech companies, Alibaba and Tencent, as well as the government. And what advantage that they've had is they've been able to insert the health code inside WeChat and Alipay. And that, again, there's no real comparable example. So overnight, I think within a 2-week period, Tencent claims that now they have 900 million users. And I think Aragya Setu is at about 60, 70 million right now. And so that sort of within that 2-week frame is pretty stunning. Tencent claims that the app has been used about 9 billion times, which is an average about 8 times for every person in China. And so I'll bring so the health code is, so what they're able to done and sort of scale that up is really not comparable with what India, the infrastructure that India has at the moment. And so, I mean, where I see the way the health code works, there's obvious utility. It's helped companies and helped businesses sort of verify people's health in a very easy and obvious way. But I'm struggling to see how this can really happen in India.
Thanks, Dev. I'd like to bring in Smitha Krishna Prasad from the Center for Communications Governance. Smitha had told us that she's been looking at some of the changes that were made post the SARS outbreak. Smitha, you want to talk about some of the legal changes that were made post SARS, and what can we learn from that?
Sure, Nikhil. I think basically a couple of the examples that we've seen of good practices, so to speak, would be the changes that were made, for example, in South Korea. I think after the MERS outbreak, actually in 2015, these changes were made. So if you, India, we've mentioned already how India has integrated disease surveillance programs and plans for such situations in place. But in South Korea, they have an infectious disease prevention and control law itself, specific to these situations. And I think after 2015, they amended it to kind of take into account the fact that more personal data will be collected, I guess, take into account the use of technology for such situations. They've specified that they've specified data retention limits in this law. They've specified notification requirements post facto, but it's still there. And they've also said that at some point, all of this data that's collected and the processing of this data will then be subject to the general privacy and data protection laws of the country, right? So it's a graded response. It's not that everything kicks in right at the same time, but there's been some thought to figuring out how data protection fits into the collection of health information and the disease surveillance programs that the country has in place. That's, I think, the biggest example that we have. And I think from what I've heard, at least, that's something that was accepted by the civil society and privacy rights advocates in the country as well. So it was something that wasn't really opposed. The way it was done was seen as acceptable. I think that's the biggest example that we have. There's also been a couple of other examples of, say, some countries like Canada, which have experienced outbreaks previously. So very soon into this particular pandemic, Canada, the data protection authorities came out explaining what exceptions are available to the government and explaining how data can be collected and how disease surveillance can be done in accordance with the data protection laws in the country. So there are a couple of different approaches that can be taken. And of course, we've already discussed a little bit how the EU looks at this as well. And I think so the concern is that in India, while we have a disease surveillance program, it's not from what I've seen so far, at least, and I looked into a few of the forms that are available, a few of the plans that are available and things like that. It's data protection or privacy has not really been a concern. It's not really addressed in any of these, the documents that are out there, at least as far as I've seen, right? Traditionally also, all of our health laws just focus more on confidentiality, doctor-patient confidentiality and issues like that, rather than go into a more detailed explanation of how data protection or privacy rights can be taken care of in this context.
Right. Thanks, Smita, for that. Before we get into whether the current privacy incursions are legal, there were a couple of follow-up questions. Mr. Patnaik talked about proportionality, but another tenet of the Puttaswamy judgment and of privacy rights in general is necessity. So when we are evaluating any of the privacy incursions happening right now, we also need to evaluate whether they are necessary. Because right now, during the pandemic state, it might seem that everything is necessary. So we'll get into a discussion about that. And just a reminder to all the panelists and also to all the attendees on the discussion, you can raise your hands either virtually or physically to interrupt anyone, not to interrupt, but to indicate to us, to Nikhil and me, that you want to make a point. And now we'll just get into a discussion about whether the current privacy incursions are legal. So Alok from Vidhi, is he here? I'm sorry.
I'm here.
Yes, sorry. So many screens. So if you about whether these incursions are legal.
Okay. Thanks, Aditi. Thanks, and it's a great seminar that you've organized here, and a very interesting set of people. It's hard to say what is legal and what is not when we don't have a clear-eyed sense of what is the legal basis for a lot of things. And the difficulty here is this. I think the point was very initially made by Mr. Patnaik about the epidemic diseases and the NDMA acts. In my view, these are actually legislations which allow for the imposition of a kind of emergency. Now, when everybody hears emergency, they hear emergency with a capital E, which is that particular instance which was imposed in 1975. Our constitution actually provides for 3 different kinds of emergencies, but that is not the total list of emergencies or states of exception allowed under the law. You could say even the imposition of section 144 is a kind of emergency to respond to a specific law and order threat or a specific need. So what Epidemic Diseases Act do and the NDMA do is to allow authorities to exercise certain powers that they would otherwise not be able to exercise in the course of your regular situations. Now, both these legislations to me are inadequate for the purposes of a proper privacy regime, to come up with a proper privacy regime. Forget about that, they're actually fairly inadequate to even tackle something like COVID-19. The reason is because these legislations were made as somewhat reactive laws, not to address future epidemics. Now, if you have the Epidemic Diseases Act of 1897, it was made during the outbreak of a plague. And this plague largely affected rural areas. Keep in mind the 1918 pandemic, the Spanish flu pandemic, occurred largely in urban areas. So even the measures that they had taken, which sort of helped contain the plague pandemic, the plague epidemic, the bubonic plague epidemic in India, didn't help that much. And we see that there was a very wide and uneven way in which the plague played out in India. The National Disaster Management Authority came out in the context of the 2004 tsunami. That was designed for multi-state disasters, but was never intended to be applied nationwide. Nationwide to the extent where you are effectively trying to run the country from Delhi. Now, the central government is finding that it's an increasingly hard task. There is a difference between dynamism and complete chaos. I accept the point that Mr. Patnaik and I think Mr. Bajpayee made, that the government has to respond and react. But it can't keep responding and reacting where it changes its mind about something every 2 days. There has to be some coherent idea of this is what we're trying to do. Yes, we'll respond to situations as they come and forth, but you can't keep creating situations. I can give you one classic example, which was the recent notification to open up shops and stores, which required some 4 clarifications for people to even understand what the initial notification had said. So I wouldn't say that is dynamic. That is simply just an example of a very poor implementation of something that you had in mind, but you couldn't translate it into law. This brings me to my point that what is really going to help us let's say, manage a pandemic like COVID-19 or address any future diseases such as these, right? These are not such epidemics. These are not something that happen once in 100 years. They may be of intensity, maybe once in 100 years, like the Spanish flu and COVID. But if you actually look at it, an epidemic breaks out in India every year in some part of the country. Bangalore, for instance, last year had a sudden terrible outbreak of chikungunya and dengue, and nobody knew how to respond to it. Or rather, the BBMP's response was so slipshod, we don't even know how many people are affected, how many people died because of it. We've had outbreaks of encephalitis across North India. Kerala had an outbreak of what is colloquially called monkey fever, but I think it was, or rather, in coastal Karnataka and Kerala had an outbreak of Nipah virus. So we keep having something like this breakout once in a year. It's just that maybe the intensity is its highest, but we've gotten very complacent about how we're going to handle these. And what COVID-19 has done is to shock us out of these complacency. To me, the most effective thing that is going to ensure that we manage COVID-19 correctly, not just we, and I mean everybody across the world, is a factor of 2 things. One is government capacity, what your government is capable of doing. And if the government says we want to do this, will you be able to do 90% of it, 80% of it, 50% of it, or even just 10% of it? That is the first factor. The second factor is how much do people trust the government, right? See, this part of the equation is forgotten. When everybody talks about government capacity, just assume as if government does something and people quietly comply. That's not true. If we are seeing the story that we are seeing across India, and I think Mr. Patnaik's example was a beautiful one about how the government builds trust. How do people trust the government that, okay, when I'm giving my data to them, when I am following the rules, it is actually for the greater common good, not for individual good of any one particular person. So, which is why I think these 2 factors are going to play a huge role. And it's also going to be something that has to be kept in mind while putting in place privacy safeguards for any future pandemic. So start with, I don't think the existing laws, there is create a state of exception. They're not sufficient to ensure proper privacy protection. That doesn't mean that we should continue to use them. We need to have a new legislation. That new legislation needs to seriously think about privacy protections. Because once again, and I repeat this, and I think this point has been made by others, we are going to be operating in a veil of ignorance. I think Malvika made this point that this is something, Malvika Raghavan made this point, that this is something that in the future pandemics, every government is going to operate under this veil of ignorance. They will not know what exactly is happening, but they still have to take some good faith measures on how to tackle it. And to do that, you will have to gather as much data as possible. You will need to collect as much information as possible. You will need to do contact tracing. Contact tracing is not something that started with SARS. If you actually look back to even how the plague epidemic in India was addressed in the late 19th century, contact tracing is one of the measures that they follow. So you are going to need government to do all these things, but it cannot do it in a manner that doesn't win it the trust and confidence of people. Now, and this is subject to, of course, more research to be conducted. It will be very interesting to see how different states respond to the Tablighi Jamaat challenge. How many states, like what Mr. Patnaik described, were able to ensure that people came forward? I know Tamil Nadu was successful in doing so. To a certain extent, Karnataka, but also Karnataka failed miserably on another aspect of this issue. But certain states had to take coercive measures to do so. Or was it because that people did not trust these governments to be able to handle their information set properly? Did they trust that these governments would not treat them fairly? Did they believe that these governments would take coercive measures against them? I think these are all questions that have to be answered. And at some point of time in the future, when we're designing a privacy law, which are not privacy laws, a law which governs the handling of epidemic diseases, it will have to have privacy protections. But I don't see it as a pure binary of privacy versus health. I would see it on a spectrum of what measure will ensure the state can do something without losing the trust of the people. Okay? If we can fit in measures, if we fit measures in, I know Malvika Jairam has heard Veil of Ignorance and brings the John Rawls into it. We'll go into that discussion a little later. If we truly want to sort of ensure that any measure is effective, right, in protecting privacy, it will have to be something which will allow the government to do what it needs to without causing the trust of the population to drop.
Gopal, do you want to add something to what Alok just talked about? Gopal,
Yes. Hi all, and thank you for organizing this seminar. I'd just like to react to a few things which would stitch up, I think, that started with Mr. Patnaik and then both the Malavikas and Alok, which is this issue of trust. You know, Mr. Patnaik used a very catching phrase, which I couldn't help but smile at, when he said that when the chief minister said, "I'll take care of you," 43 Tablighi guys came out and gave their names. The question is, what comes first? Do you create a system where you start trusting the person in charge first? Or do you react to it and then try and create trust? If Yogi Adityanath said, "Come out and tell me who you guys are and I'll take care of you," I can assure you there's a different interpretation given to it than when Naveen Patnaik does. And the reason is that you have to have created that sense of trust for a while so that I can trust you. And I'm going to come out and tell you and know that I'm not going to be at any point put to the point of a sword. So I think I find it interesting that we're talking about trust, because what's happening here is tying up with what Alok said about how the legislations of the Epidemics Act and the National Disaster Management Act and the laws we've had are all reactive. You know, even this conversation is reactive. We are having it at the time of COVID, right? But if we think about the institutions we should have already had in place, if you consider the fact that for privacy, Canada has a privacy commissioner. That privacy commissioner puts out a set of protocols a week ago, which takes care of many of these instances. We understand that where India is lagging behind is not having institutions in place. If today we have a privacy issue, it's necessary for us, before we worry about how our rights are being violated, etc., we have to consider what is the role and the responsibility of our government towards us. And I'm seeing a failure there, because every time you apply any of these tests of necessity and proportionality, etc., what do we balance that against? If the government is not communicating to us what the aim and purpose of the steps they are taking is, then we have nothing to balance it against, right? And this ties up with Malvika Jairam's point about the practical effects of civil society in any way, taking up these rights and canvassing them. If civil society were able to get that funding, then civil society will have to engage lawyers. Civil society will then have to take it to court. And today, the Supreme Court, at least because I have an experience of what's been happening there in the last 4 weeks, they have adopted a deplorable platform called Video, VID-O, has insisted on staying away from better known international platforms which billions of people use, have decided to, every time this link is put up and lawyers are not able to get themselves heard, cases eventually get heard in some sort of way by judges who, strangely in the Supreme Court of India, are sitting together in one person's house. I don't understand how that is social distancing by the judges of the top court in our country. And when they are asked to intervene on behalf of migrant laborers and other people who are completely put out by various steps that the government has taken, the Supreme Court actually, if I may use this word, gall, to say that, look, we are not equipped to deal with this kind of a situation. We are sure the government knows what it's doing. Well, if the government knew what it's doing, people wouldn't be dying on the street and they would have had all these steps in place. So I just want to vent a little bit about the fact that, look, we need to have institutions in place. That's the first step. We need to, secondly, question the government and ensure that the government puts out its information fully. You know, other countries have one central authority which actually shares the information about what they're doing. We have a Ministry of Textiles which is putting out details about what the PPE kits will consist of. We have the Ministry of Health and Family Welfare, to whom the Home Secretary has delegated his powers under the National Disaster Management Act, some of his powers. So they put out notifications. Those notifications are inconsistent with notifications being put out by the ICMR, which comes under the Ministry of Health. So this is all apart from the various state governments doing their own thing. So we have no single nodal agency for any of this. But having said all of that, let's come back to the three principles that Puttaswamy told us about. If you're going beyond, personal liberty and other aspects, it said legality, necessity, and proportionality. Right now, I don't see legality. Forget about necessity and proportionality. Where is the law that permits you to impose a lockdown? That doesn't exist. By any stretch of imagination, the Epidemics Act and the National Disaster Management Act cannot be those. I agree with Alok that emergencies are not only what the Constitution lays down, but in the garb of claiming this is a sort of an exception, I want to see the law under which you did this. We haven't seen an answer to that yet. And eventually, if we boil it down, what the government needs to do, and many of their laws don't deal with an epidemic scenario, but the Privacy Bill does. In Section 12, it says that the information that is taken can be processed when you're dealing with an epidemic specifically, and when you're dealing with the giving of services during an epidemic. I think it's necessary for us, like I said, to ensure that things like social distancing, data collection, mandatory reporting, and curbing of rumors, all of these are specifically put out by the government saying these are the purposes for which we are going to take measures which are necessary at this point of time. We're at a very early stage in India because our lockdown hasn't ended. We are not seeing the real numbers. We'll see it when the lockdown ends and the numbers start shooting up. So these are things that the government needs to communicate to us so that we can, against each of these, then decide this is the specific purpose for which you're taking our information. Let us know what information you're going to take. What are the safeguards regarding it? How long are you going to keep it? Some of these aspects are dealt with in the Privacy Bill, but we need to have something on the ground right now which takes care of all of these, because for me, I don't think we have a legal framework in place, and we are not getting enough communication from our government in that regard. So while in the 1975-77 emergency, there were laws that they came up with which were extreme, and they were dealing with personal liberty, remember, in Article 21 interpretation prior to Maneka Gandhi. Now, after this entire basket of rights theory has come up from the Supreme Court, we are talking about a completely different situation now, where the access to food, the right against sexual harassment, the right to the environment, and right to privacy are all read into 21. Now, if you're dealing with that, what are the kind of safeguards you're going to have in place, and to what extent can you balance it? It's going to be exciting times if anybody decides to bring it to court, but to the large extent that I can see, the Indian populace has decided in some way to play ball with the Indian government and accept this lockdown and not challenge it, despite the fact that there are glaring lacunae. Those are my general thoughts.
Gopal, just to add to that, we're also seeing differential deployment of violations of privacy in different states, different areas. For example, we've seen police departments use drones and then upload footage where people are clearly identifiable. We're seeing different government, different state governments release different sets of data in the public domain. There are photos circulating, of houses with stickers with names and addresses on them all over the place. So there's a lot that's going on.
Yeah.
At one level, you want to take this down and allow states to manage themselves, or allow even district administrations to manage themselves. I'm just wondering about whether it's even possible in this scenario.
Well, see, for this, you need to first understand under what legal framework this is coming. If they say that this is covered by the innocuous term, any measures, which you find in several of these legislations, then the second question arises as to whether you had to take this step. Was it absolutely necessary, or was there a less invasive step you could have taken? And finally, after you decide whether it's disproportionate to whatever purpose you're seeking to achieve, you have to decide whether you can take it to court and whether a court is going to interfere. Because I think a very, very practical question we have to ask ourselves at this point of time is, are our courts willing to interfere at this stage? I know Gautam has mentioned this on another forum, and I'm very honestly telling you, as a practitioner going to court every day, I am getting the sense that our courts are unlikely to interfere in this kind of a scenario, right? And are willing to postpone any discussion on things which they think are rights of luxury, like privacy, right? Because even when it came to the right to food and the right to health, which are in many cases way more important than right to privacy of migrant laborers, they were not seeking to step in. They deferred to the wisdom of the government. So very honestly, while we discuss this at a theoretical plane, I'm very concerned about the fact that on the ground, I don't see, even if you do muster up something to take it to court and say, look, you put a poster of me, of my name.
The fourth fountain of wisdom.
I beg your pardon, I'm sorry.
So we couldn't hear you, you were on mute.
It's too much to believe that the courts are also fountains of wisdom.
Yes, absolutely. We've seen enough for a long time to understand that, especially in an emergency situation, right? I don't see our judges going out on a limb in case they might make a mistake and they have to make amends for it, because they did do that. If you remember about the compulsory lab testing order that they passed it without hearing any of the labs, and they passed it on an ad hoc application made by an advocate who was there in public interest. Eventually, a doctor had to move. I appeared for him, where we had to have that order rolled back and say that, look, people who can afford to pay the tests, how are you saying that they need to get it for free? So I'm not sure that I'm not very confident, I'll tell you, to be honest, at a time of an emergency, whether our courts will actually stand up to protect a luxury right like privacy.
But doesn't it also prove that this is a kind of situation for which no one has an answer? Even the law doesn't have an answer.
We have an answer. The only thing is people are not
the
going
answer
to
is one can wish.
answer.
We can only wish, but the point is the operationalization, the implementation is equally important. And that even the courts can't do, or the legislature can't do. The executive knows best what it can deliver. So I think at some stage you have to, because I know that when the Fileene happened, the Hudhud happened in Orissa in 2012, that was a disaster. We decided that there will be zero casualty. So move all people out from that area, from the storm, the eye of the storm, and take them to cyclone shelters. And there was no casualty. I think the UN applauded and everybody. Yes. Nobody had followed that kind of an approach earlier at that time. But the point is, one could say that there were groups of people who would not even move. So finally, they were moved by police force, because they really didn't understand that the force of the cyclone was such that they could actually decimate not only their houses, they could also decimate them. So I think at some stage in this kind of thing, I agree that there is that's what my question was, whether you need to have a separate surveillance law for epidemics and diseases, and the other thing, whatever is there, is not very robust. But I think for all eventualities to prepare may not be possible. This is just like, and this is just you said something about emergency. Actually, this epidemic has been declared as a notified disaster, and disaster is under the Disaster Management Act, which is permissible. And the lockdown is also done, just as we talked about the evacuation of people from the area, complete evacuation, physical evacuation of 12 lakh people in Puri during 2013. So lockdown is a similar kind of some similar kind of, it's like a curfew, which the state has the power. The point is, for addressing an epidemic of these proportions, which is a pandemic, where it goes much beyond what you have seen, just like a super or a very super cyclone. First time super cyclone hit Orissa, 10,000 people died in 99. But the lessons were learned, and later the cyclones were even much stronger. The Fani cyclone was much more stronger than the super cyclone of 99, but we handled it because there were only 7 casualties. So the point is whether the data, you need to have data and the purpose. That point is, I take it is very well taken, that the data has to be taken and the purpose should be mentioned and utilized for that purpose, so that the future reactions or the future kind of response to this disaster would be better. That's what I think would be a fair thing to say. But in all this, the privacy of data has to be respected. I think that I think we have to keep that. It is not a binary choice. It is not a binary choice.
So I think Gautam Bhatia wanted to respond to some of the points made. Gautam?
Yeah, thanks. And not so much respond as take them forward a little bit, and also the questions that you put to me earlier about the state of exception and issues around that. So just a couple of examples from other countries to start with. First, on the importance of institutional frameworks. Interestingly, in South Africa, what they've done is that they have designated a former constitutional court judge to oversee the government applications for surveillance during the course of the lockdown. And this former constitutional court judge is Justice Cato Regan, who is one of the most respected judges across the political aisle in the history of the court. So, I mean, there are ways that you can, I think, ensure that you set up institutional frameworks that create a kind of oversight mechanism without interfering with the ability of the government to manage the pandemic in a dynamic fashion. So I think that those are options that need to be considered seriously. The second, and this is I think the broader point, which is about the whole question of the state of exception and the manner in which this pandemic is being managed. So, I mean, the way it normally operates in the legal framework is that you have the legal landscape that deals with situations in normal times. That is, the default legal landscape, and then you have the state of exception, and that is premised on on our shared belief that in cases of crisis, which this is one, no doubt about that, you need to suspend some of those principles that operate during normal times. Now, the reason why it's important to keep these two separate and clearly separate is that if you don't do that, the possibility of the state of exception bleeding into the state of normalcy becomes a very strong possibility. And that's why if you look at the Indian Constitution's emergency provisions, there's a clear insistence that there must be a proclamation of emergency. There are processes that lead up to that, subsequently ratification by the parliament, and a definite end date, right? So the emergency begins, the emergency ends, and then we go back to pre-emergency times once more. And so that ensures that you keep these two legal regimes strictly separate. Now, the problem I see with the handling of the present pandemic is that both the National Disaster Management Act and the Epidemic Diseases Act are not formally emergency legislations. So all you need to do to invoke either of them, as we have seen, is that the central government or the state governments, as the case may be, invoke these laws, and then these laws have umbrella clauses that give exceedingly broad powers to these governments to manage the pandemic without parliamentary or other involvement and so on. So I think that the issue, and I think this comes back to a point made earlier, the need for a dedicated legislation and legal framework that deals with issues like this and spells out the extent to which rights are to be temporarily suspended or not, the standards that must be used to, declare the beginning and the end of the state of exception, and what happens during that time. You need to have a discussion on that. You need to have a specific law that's passed by, the elected bodies, so that the framework can be clear. It shouldn't be under these kinds of laws that are just have these broad provisions and where basically anything goes, and the executive has the sole prerogative, which is unchecked by any kind of oversight. So that's, I think, one broad point. The second broad point, and this is a shorter one, is again, I think it is again draws from a point that I think Mr. Patnaik made and others have made, that there are certain kinds of rights, that need to be suspended or temporarily infringed during a pandemic. And I think this whole example of needing to transport people during the cyclone is a very good one, because of course you can technically raise the freedom of movement right and say that this is being violated. I think everyone understands that for the purposes of dealing with this disaster cyclone, you need to temporarily suspend freedom of movement rights just to deal with this situation. On the other hand, there are other rights which cannot be suspended even during such a pandemic, and there you again have the question of data, right? So the way data is collected, gathered, and used, as long as you have the principles of purpose limitation, data minimization, which in any case apply to a normal time, that is fine. But there's no reason why you should be allowed to go beyond those principles and cite a pandemic to justify that, because you don't have an extra edge or added benefit to tackling the pandemic if you can give a go-by to these basic principles. So I think the question of which principles remain sacrosanct during a pandemic and which can be temporarily given a short shrift because you need to do that to deal with the pandemic, that's an important question. And that also must be a democratic decision that's taken after due deliberation. And so I think that these two issues, one is having this clear separation conceptually and legally between the state of normalcy and the state of exception, to ensure that the two remain separate and we don't normalize the state of exception is one. And secondly, even within the state of exception, that certain rights need to be protected because they remain sacrosanct. That also has to be thought of seriously. And I think privacy is a right of that kind, as we have seen in the course of the debates over the last couple of weeks.
So we're kind of running short of time for this session because we also want to get into what checks and balances can be put into place. We're already 75 minutes up. So I'm just going to quickly, just for very short and quick interventions, just going to go back to Malvika Raghavan, who wanted to respond. Malvika?
Thank you. Thanks for that. I just want to make two quick points. Firstly, actually, I don't believe that privacy is a luxury right. And I think especially in a digitizing world, what we are constantly seeing on the ground is that people who are most vulnerable have the most to lose from bad data quality or incorrectly collected or shared information. It results in a lack of data, direct benefit transfers, a whole range of issues, which I'm happy to talk about. So I actually think ensuring privacy and appropriate disclosure and clarity of disclosure and handling of especially vulnerable populations' data, especially COVID positive patients' data, is central to this pandemic. Having said that, the second quick point I wanted to make is to bring it back. This is a public health issue. My concern, and I think this is what Malvika Jairam was getting at as well, is that you do have legitimate state aims in a pandemic to access data, and you have legitimate step into emergency powers. I think the concern here is the illegitimate state aim that comes from pushing a kind of technocratic narrative that all this information is needed, and there's no loop back to why. Like, what is the health justification for this? And I think the emergency powers justification, I think to add to what Gautam said, it's about suspensions of rights. It's also about enhancing executive powers. And I think maybe that's the segue to your next section. I think, when you're enhancing executive powers, we don't need a written law always. In this kind of situation, it will take time to pass a written law, but there are some basic principles that we already understand in terms of the conditions that arrive when you have emergency power and limitations that operate when you have emergency power in a rule of law country. Now, maybe the question here is, are we slipping away from a rule of law country altogether? And maybe that's just a bigger can of worms.
We will take that up separately, Malvika. Just I'd like to bring in Divij, who's been waiting for a while. Divij?
Thanks. I just wanted to quickly add that, one of the factors in a proportionality analysis that the Supreme Court is going to do, and this carries from, Malvika's point, is that any measure restricting privacy needs to be a suitable means of furthering the ultimate legitimate goal, right? If the legitimate goal is furthering public health or countering the pandemic, then the government needs to specifically prove how this data is actually going to help. It needs to make that information public. It needs to make the technical systems that are being implemented knowable to the populations that are supposed to use it. And I just want to rope in other examples from, historical examples of the use of big data in various contexts and how it's actually proven disastrous, or at least has kind of, sought to sideline the actual issues of kind of equitable access to public health. And this is the example from, for example, Sierra Leone and how big tech companies started trying to use big data to counter the Ebola crisis. What happened instead was that they found that because of, the lack of widespread technology adoption and the fact that the kind of technologies of GPS as well as call data recording were not appropriate for that context or for fighting public fighting a public health epidemic, it eventually sidelined from the actual role and led to, decisions being made about resource allocation, which, as Malvika said, affected the people who are most unlikely to be able to challenge these systems at all. So we need to be really careful about even assuming that technology is going to be very helpful or what kind of data is going to be helpful, because as we've already discussed, the systems that we're trying to put in place to solve a humanitarian crisis were never created to solve a humanitarian crisis. They were created for reasons of policing and surveillance or reasons of profit making by private companies. And you can't suddenly repurpose them and say that this is a humanitarian intervention. So we need to be critical about how far data and technology is actually going to go and whether it's going to detract from more important issues of universal access to health.
Nikhil, you're on mute.
Sorry, just going to bring in Rahul Narayan. So a few people have their hands up. So Rahul Narayan, then Vrinda Bhandari. Rahul?
Yeah, I'm just going to be very short because it's been an exceptionally good quality of discussion, and so many of the points I wanted to raise have already been raised. But two broad pictures come to my mind in this discussion. Firstly, there is the institutional framework, which comprises of the need for a law to exist to allow this sort of thing to take place. And second, what the content of the law should be. Now, in terms of what the content of the law should be, I would defer to, at this time, at least to the people who are dealing with the problem from in a practical point of view. Like, for example, until now, I always thought that there was no justification at all for releasing people's names. But yes, I mean, subject to what we heard today from Mr. Patnaik, I think there may be some justification where there may be need for people's names to be revealed. So at this time, maybe what best can be done is to concentrate on the institutional framework. Firstly, of course, a law needs to exist to allow a broad violation of rights, because under the Constitution, this is not an emergency. If it's not an emergency, means a normal panoply of rights applies. That means the courts have no business saying that, oh, this is not important enough these days, so we're not going to look at it. So the courts and everybody has to act in accordance with the law as it currently stands. Now, in terms of, for example, say the NDMA, which exists in this and gives these enormously broad powers, as well as the Epidemics Act, I don't think this is either justified or correct to allow massive amounts of legislation. I mean, this is actually legislation. You may call them, I mean, they are, in theory, they are regulations, but they're actually legislation, And to allow, for example, things like punishment based on regulations and rules is completely impermissible in law. It would be far better to have a broad legislative framework to permit this. Now, another example, like for example, in Parliament, in the House of Commons, if a bill is declared to be a money bill by the Speaker, which means that the House of Lords cannot look at it, the Speaker, while making this decision, has to consult with two backbenchers from opposite parties. So this basically means, for example, that the Speaker cannot on her own decide this is a money bill and do whatever she feels like doing. So if there's a power which is given for a particular purpose, it is broadly shared. Similarly, if we are to have a national disaster management committee or an association, let it be fairly broad-based. Let it have people from the states, let it have people from the opposition. So at least let the decision be broadly taken. If a decision has to be taken by somebody, it needn't be that one person. It could be rather a whole panoply of people. Similarly, I mean, if an emergency under the constitution has to be looked at every 6 months, let regulations like this be looked at every few months as well, you know. So there are ways in which a law, if interpreted, will, you know, this will certainly apply to the proportionality analysis. If, for example, you do need contact application apps to some extent, which would be awful in the normal means, awful circumstances, then at least the fact is that this sort of a law which would put a definite time gap to it, or a purpose limitation, would certainly help in this, wouldn't it? I mean, I think that the fact is that if I were to know that this app would be used only for this purpose, and another example of that could be the Census Act. Information collected for the census cannot be used for any other purpose. So why not information collected for contact information cannot be the start of a health stack or something? It should just be limited to this as well. So maybe there are basically all kinds of safeguards which when put into place would certainly assist in making the thing more palatable from a legal point of view. Let's not forget that, you know, and this is again back to a point somebody made earlier about, you know, let people take the decision now. This is not the way democracies are supposed to work. We don't, you know, appoint one great dictator and bow all before him and say whatever you decide will be right. Let there be a larger decision-making authority, and let them consider various things which they consider in normal times anyway. I mean, I'm sure that the quality of decision-making only improves with this. It's not that one person is the fount of all wisdom, and we shouldn't think in these terms.
Okay. Alok, you wanted to jump in? Alok, your mic's off.
Sorry, I just wanted to make this one small point. And I think sort of the discussions, Malavika Raghavan, I think sort of raised the point that it should only be relevant data and not all data. I hesitate to say relevant because, and I think actually just made the point that it's really hard to determine a priori what is relevant. Now, obviously, there is some which might by definition be relevant, but I think the point that was just made that you know, who knew that maybe making the names public might be necessary in some instances. I mean, not to say that is with the use of the data, but to collect it, you may have to collect the names at some point of time. You may have to collect details of transport, travel. You may have to collect details of past health records. You may have to collect details of record. Now, obviously, it's easy to define what is irrelevant, but I don't know if it is be that easy, especially in a pandemic situation, to define exactly what is relevant. So, which is why I would hesitate to add too many qualifiers to the term as to what data government should collect.
Okay. I'm just going to bring in Brinda Bhandari. Brinda, I wanted to, one of the things that we also wanted to understand, if you want to respond to any points that have been made so far, but also something on proportionality in your view from the Kashmir internet judgment in January. Is there anything that we can learn from that?
Yeah, so I'd like to speak on the Kashmir issue, but just before that, if I can respond to a couple of points, so just give examples. You know, we've been hearing a lot of talk about, you know, purpose limitation and, you know, whether this is a health emergency or a national security and how we should deal with it. And just an example which I think didn't get enough attention. So the Broadcast Engineering India, you know, BESIL, the Consultants Limited, which is under the INB Ministry, released a tender, and they were asking for like a COVID-19 patient tracking tool. The tender said it was for the supply of healthcare equipment only, right? So presumably this is for a health supply, we need to have a tracking tool. But if you see the specifications that are listed, they actually talk about investigation. They talk about, you know, the places where people frequent. They want to know where people are sleeping at night, where they're working during the day. They talk about national security, you know, powers that are also really important. So I think there is a real, you know, under this guise of, or under the genuine pretext that yes, we need to solve a health emergency, you are actually, national security has become a part of it and surveillance has become a part of it. So that's why purpose limitation, I think, is very important. And even in terms of collecting data, so Alok said, you know, it's hard to define what is relevant, but I think it's pretty easy to say collecting data for health purposes should not be used, you know, data that's collected for health purposes should not be used for national security or law enforcement purposes. And the tender again uses the term infected persons in many places when it's talking about COVID-19 patients, but then also uses the term suspects in very different places. So the use of the language is also, I think, very revealing. On the point of state of exception and, you know, how we can normalize it, I think we have to think about when is the state of exception ending? It's not unlike other disaster. So even the tsunami, which led to the NDMA Act, coming into force, that's a reaction. A tsunami is a fixed event, like a hurricane is a fixed event. But an epidemic like this, like a flu, which is a much more long-term disease. So are we talking about till COVID 2020? COVID 20 comes. So there are people who think that COVID will resurface next year, in a different stream. So when will this exception end? Is it only when the when the vaccine comes, or will the government then say, look, we actually need to keep all these tracking tools because there might be another epidemic in the future, so we can't lose all of this data. And just from this point about, again, courts, what is the role of the courts in times of exception? I'll post a link, but there's just a fantastic Harvard Law blog post that came out last week, and it's a post, which it's about an article in the Harvard Law Review, which exactly talks about the role of courts in the times of crisis and how it's not to be deferential, but actually to use their institutional powers to keep the government in check, to make the government give the reasons, saying that this is necessary and this is proportionate. And just coming now to proportionality and Kashmir. So as you know, Nikhil, I told you this. I'm working right now on a matter where we are asking for the restoration of 4G internet in Kashmir on the grounds of COVID-19. So our whole argument is based on the fact that we are in a lockdown, we are in the middle of a pandemic. And in these cases, having 2G across the entire union territory is really harmful to the health of the people, to the education rights of children, to access to justice, to your right to be able to work. And part of our argument is again stretched on proportionality. There has been a communication shutdown there for 9 months. In Anuradha Bhasin, the court was very clear. This should not be a permanent situation. This is only temporary. It's only in times of emergency. But this comes to the problem of what is an emergency, right? So the government is saying since August 2019, since the whole institutional position was changed, we are in a state of emergency in one way or the other. So I think proportionality then becomes really important to say, is there another way? And one part which people haven't really discussed in the proportionality analysis is the balancing test. So yes, least restrictive is obviously something we have to argue, but the balancing test and our argument, or what we're trying to argue, is that in COVID, during COVID times, the balancing test has changed. And so what has changed is that the disproportionate effect on a majority of the people is just the balance has now changed and they are hit much harder. So doctors are unable to download the latest guidelines or advisories. Students are not being able to access any online learning services. People are not being able to work from home. And so the balancing part of the proportionality test, I think, is as important in a crisis as just the least restrictive part of the test.
Thanks, Vrinda. We're just running a little short of time. I just wanted to check if everyone's okay if we extend this by about 15-20 minutes, because we do want to we do want to talk about solutions going forward. So just wanted to check if everyone's okay with that.
I'll have to leave at 4:30 exactly.
Got it. So we wanted to also that I think Srinidhi had her hand up. So Srinidhi, would you like to say something?
Yeah, sure. Hi, Nikhil. Thank you so much. Can you hear me?
Yeah, loud and clear.
Yeah, awesome. I'll keep this very short, and because I'm going to echo a lot of what other folks have already said. I think Mr. Patnaik and Gopal have both talked about the PDP bill and Section 12. And the PDP bill does currently bring in a lot of the principles that we've been talking about: data minimization, purpose limitation, retention limitation, etc. And we've also been talking about balancing rights, that some privacy rights may be suspended at a time like this and not all. And I think that's the approach that the Section 12 also sort of tries to follow. While you don't need to take consent, you will still have to show that other principles have been followed. You will still have to demonstrate compliance with, say, data minimization, at least show that that's something that you thought about. What this could help do is also develop trust. I completely agree with Malavika Raghavan when she said that trust is core to a public health response strategy, even if it's something even if your response strategy is sort of evolving over time and is dynamic. If you're able to show that at one point you needed these 5 points of data, but as you got more information, medical experts got more information, you realize you don't need 3 of those. But you are able to demonstrate that you did that balancing exercise. You analyzed whether you needed those 3 data points or not at a particular time. And you've taken privacy into account while making those decisions. So basically some form of risk assessment, even if not a full-fledged privacy impact assessment, because I understand there can be challenges in undertaking something of that sort when you have to tackle these things in a very dynamic fashion. But Just as an example, I think Australia had recently launched its contact tracing app, and they released a privacy impact assessment alongside, and they responded to a couple of questions. So I think something of that sort will at least help create trust and sort of help people know what thought process there is behind a particular strategy.
Shweta?
Hi, thanks, Nikhil. So I just wanted to add to the point that Srini was talking about with respect to Section 12 of the PDP bill. I realize that that still is not a legally binding requirement, but the fact that there are certain lawful grounds that have already been recognized, and this is Section 12 is one of those grounds that's not particularly controversial per se. So I think that is one of the requirements that could have been considered to be ironclad or to be ironclad in nature and sort of based they should have used that lawful ground of that particular lawful ground as the main criteria for processing personal data instead of relying on consent as the main criteria for processing personal data in this case. And I wanted to include there's a wonderful European Data Protection Board guidance on not using consent as a lawful ground for processing data, especially in case of clinical trials, where they take into consideration the power asymmetry and the power imbalance between the patient and the hospital services, and how free consent is something that cannot be considered in this case. So, especially in India, going forward, I'm sorry if this is going into the next session that you wanted to talk about, but
we want to go into the next session immediately, Shweta. So you're a segue into the next session.
Then I'm doing it fine. So then I think going forward, especially in case of a pandemic, and that free consent right now, especially in case of a pandemic, is not free. And before our call started, I just saw the notification that central government employees are mandatorily required to download Arogya Setu. So, well, consent is out of the question now. So if you move away from consent and move to the lawful ground of ensuring that you have that the state government is processing data based on a particular law, there is at least one extra step of deliberation of ensuring that you are taking into consideration privacy rights of the individual, while at the same time ensuring that people are not dying. And the other point that I wanted to really get over here is, we've discussed already how right to privacy is being seen as a luxury right, but seriously, the narrative has to be changed in a massive way, since it's really not about luxury at all. For example, the Excel sheet of 19,000 people, names of 19,000 people and their addresses that was circulated in Karnataka of people quarantining in Karnataka. And then there was a map that was made and then there was a map that was made. So this right to privacy is not a luxury right anymore. And I see that a lot of people actually look at it that way, but it's not an elitist concept at all. And the sooner we move away from that narrative, the better it is.
Shweta,
yes.
What do you think in particular? I think Shivangi in the Q&A has asked this question. What do you think about Zomato forcing its workers or its delivery agents to download Arogya Setu? There's a district magistrate in UP who's also forcing, has called for the entire district and mandated that everyone in the district should download Arogya Setu. What about privacy rights in that context?
Yeah, I don't think there are any in that context, to be just very blunt. I don't think there are any privacy rights in that context, because even in case if Zomato as an employer is asking employees to mandatorily download something, consent is gone out of the question there.
What rights do the workers have? I mean, and for them it's a difficult choice because they're choosing between their livelihood and their privacy. Is that a fair choice for them to be forced to make?
No, it's of course it's not a fair choice to make at all. And even under our PDP bill 2019 version, an employer in certain cases can start processing personal data of the employee without their consent. But that is in respect to termination of employment, or I think related to background verification and stuff like that, if I'm not wrong.
Data isn't included there because that's sensitive personal data.
Exactly. So this is by no means is this something that is acceptable at all. And the only way this can be curtailed is not because technically Zomato legally is not doing anything wrong at this point, right? Because we keep on saying that there is no personal data protection bill, which means that they can do whatever they want to do in the chaos of the pandemic. But till the time there is an overarching law that most of the panelists have already spoken about in cases of pandemic, till the time that is there and that doesn't speak about privacy, I don't think these subsequent actions of organizations can be I don't think these organizations can be held accountable till that first layer of law is set up.
Okay, so I'm going to switch to the next session, particularly because we need to look at now solutions and what changes perhaps need to be made. I'm going to bring in Rahul Mathan here because he did put in a lot of work into imagining a privacy policy for Arogya Setu that addresses some concerns. And I know that there are not all concerns perhaps that have been raised have been addressed yet. But Rahul, what were the lessons that you learned, or what were the lessons in the privacy policy design of Arogya Setu that we can take away into and look at, steps for preserving privacy even in an exceptional situation? Rahul?
So thank you, Nikhil. I'm doing back-to-back Medianama events, and I haven't yet got my book. So Harneet, I want my free book.
Once they go.
Yeah, I'll settle for a Kindle ebook also. So, so thank you for putting this together, and that's a great question. And I think so. One of the things that people have been saying, which I think we need to echo, is the fact that it's really difficult to do anything in the context of privacy without some guidelines through a law. And this is precisely the reason why we need to have a law, because you cannot predict when an emergency comes. And when an emergency comes, then if you don't have guidelines as to how to function in an emergency, you start doing things by the seat of your pants. So I think, the first thing is to have a privacy law which articulates the principles that you need to follow. I think the second thing that that Mr. Patnaik said, I think, is really important, because this time we're having a SARS-CoV pandemic. Tomorrow we may have an Ebola pandemic, or we may have some persistent state swarm of locusts that cover the entire country. So you cannot prescribe specific provisions to deal with emergency situations. But if you do not even have basic principles that that define how you should act in the context of data collection in this particular case, you're left completely in the dark. So I think the most important thing really, and as I was drafting the privacy policy, it would have really helped if we had a law, one. Secondly, if we had a data protection authority that would have, and many people have said data protection authorities around the world have come out with guidance. And that would be what I would expect a data protection authority to have done in India, to come out with some sort of a guidance saying this sort of action is good. If you want to collect data, remember that these are the things you have to take care of. And that sort of answers the first point I raised also, which is that you can't have prescriptive solutions for an emergency. But if you have a regulator who has some principles to work with, the regulator can then translate those principles into prescriptive provisions or guidance for that specific emergency, which is what we need. And then the second point that I will make outside of the need for a law and the need for some sort of guidance like this is that an emergency like this leaves you completely unprepared. And so the measures that will be taken are rapid measures which require to be iterated. So you need to have a system in government or in the executive or whoever is doing it that iterates in a sensible, reasonable manner. And when I say iterate, if you push something out quickly, you will make mistakes, which is the first version of, and Nikhil, you mentioned this earlier in the introduction as well. The second version of the privacy policy, I believe, is better than the first version that was issued out. And there will be other versions. And as I mentioned the last time I was on a Medianama panel, I have sat in and listened to a lot of the comments that have been made, and to the extent possible when the government asked for my inputs on changes that are required, a lot of these things are fed back. Now, the rate at which these things can be iterated into the product is really not in the control of many people. And some of these things just can't come into the product as quickly as we want. I think one comment that came through even last time is dynamic IDs. So right now we've got a fixed ID. But if we can get a dynamic ID, everyone says it's faster, it's better. My assurance from the team is that is something which is a top priority as far as the app is concerned, to try and bring that in. It's just that it's not happened yet, and I understand that it's on the roadmap. So these are the sorts of things that I think we've got to keep in mind, because no matter what the next emergency is, you are not going to have the luxury to sit down in development team meetings. You're not going to have the luxury to get legal and ethical people on board to give you their answer immediately. And so you have to adjust to the iterative process. What would be unfortunate is if the government and if everyone who's building these apps doesn't listen or does not perform in this iterative way. And if there's anything that we as civil society can do to try and figure out how to improve that process, certainly we should. I mean, I think.
So Rahul, if I may interrupt,
sure.
what would you like to see? What are the norms that you would like to see in anything else that follows, or anything that happens in the future? What are the basic principles that you would like to see, and where would you like to see those basic principles being implemented outside of the privacy law, for example?
Yeah, so leave the privacy law out, because the next issue may not be a privacy issue. There may be some other issue that we've got to deal with. But what is important is discussions like this. So what needs to happen is the informed people in society, technologists, lawyers, privacy experts, need to bubble up issues that are critical and that need to be pushed through in whatever measures are being taken by the government. That's as far as civil society is concerned. As far as government is concerned, I believe that there's got to be some kind of a mechanism by which that can be taken in. It can be, people can figure out whether this can be implemented. If it can't be implemented immediately, there should be communication back to civil society. I think, one of the problems with a lot of these things is this sort of opacity and the fact that there isn't much communication. I think with more communication, there is more trust. And someone mentioned early on, trust is critical. I think Gopal, with a rather acerbic kind of a example, drove that point home. But communication is critical, and the government's not very good at it. Quite frankly, none of us are really good at communication, because when you communicate, you run the risk of someone pulling you down for the communication that you made, and then you just clam up and you don't communicate anymore. And that's sort of not the approach that either you or us should.
Governments have to have thicker skin than that, Rahul. But what I just want to go back to, were there 3 or 4 operating principles that you have adopted? What are those principles, and what would you like to see in any future initiative?
Okay, so I'll just talk about the 3 principles that we did use in Arogya Setu. One is anonymize as early and as well as possible. I think we've done it early. We haven't perhaps done it as well, because dynamic DIDs is probably going to be a better solution. I think the second is pull the data only when you need to. In contact tracing, you have to get, if it is to work, you have to have a history of data. But the only way to collect a history of data is to turn some tracking on such that you can build the history, but you don't have to pull it up to the cloud until you absolutely need it. So the design of the app is that it will stay on the device for as long as is necessary. So that's the second measure. And the third is delete it after you have used it or when it's no longer useful. And so on the app, it deletes on a 30-day cycle. If it's pulled up to the cloud, it deletes on a 45-day cycle or on a 60-day cycle if you're infected. And so these, essentially, the other thing which lawyers would love is that the purpose is clearly mentioned. Now, all that one can do is say this is the purpose. And then if people have raised the point that sometimes it gets misused for law enforcement or some other reason. Well, there is a purpose. And if it's misused for another reason, then we have a mechanism to hold the government accountable, saying, you said you would only use it for this. It's clearly said in your privacy policy. If you use it for something else, you're violating the purpose. So these are the measures, that you put in. Ideally, I would also like for the app to sunset. I think in our last conversation, Aditi mentioned that. And yes, we've mentioned open source. I think transparency is critical. I would also like for the app, the code to be released open source, not for anything other than it's just a measure to build trust. And of course, if there are defects in the app, it will really be good to get feedback from the community to fix it. Just to also add, there has been feedback that has been sort of implemented even in the code, and so I think you ran a session or someone else ran a session some time back where there were some bug fixes that were raised and addressed. So yeah, I would imagine these are the principles that you would follow.
I'll just go to Malvika Jairam next. Malvika, in any implementation, what are the kind of checks and balances you would like to see to protect privacy from any government?
I think one thing is to make sure that you're not relying entirely on privacy laws to protect you. There are so many other measures that you can take. So sort of shifting that sliding scale or making a different kind of privacy bargain shouldn't be your first line of defense, right? Delivery workers, gig workers in Singapore who are essential to keep things going, every single provider has ensured that they can't ring your bell and deliver it to you and hand over things to you in person. They will keep it 6 feet away from the door for their protection as well as yours. So I think there are so many extra legal ways to build trust, right? It isn't relying entirely on the legal system. And I think these apps are also only as good as the uptake, or should I say download, right? Even the Trace Together app in Singapore, a country that has, to me, ridiculously high levels of trust in government, 17% of people have downloaded it, right? So I think trust is great, trust is wonderful, but I think it doesn't, it actually ignores the way that people actually behave. It doesn't actually address the sort of behavioral aspects of how people function. They can download it, but will they actually, they're worried about their battery draining, so they're not going to keep it on, like Bluetooth issues, which now certain apps are like working around, so you can keep it downwards, so it's not actually draining your battery. So I think there are so many technical and other human and behavioral changes that can take place so that you're not expecting the privacy invasion to be the main sort of attack surface, if you like. I think the other thing is that you have to recognize the privilege that's involved in social distancing measures, right? If it's running rampant in a dormitory like we had in Singapore, where we completely ignored it, we thought we were the gold standard for everything, for the app, for the law, for trust, for closing things down, but you completely neglect the worst of the invisible part of your city that lives in alternate reality. It's really nice to say you should practice social distancing when you're 20 men in a small room and you're all using one bathroom for 100 people. Try doing socially distancing measures in that kind of a scenario. So I think if you don't look at the context in which even legal and legitimate measures are enforced, you sort of, you're missing the wood for the trees. And I think the other point is you really need standards. I mean, I know Rahul was talking about principles, but I think a lot of the countries that have fared really well, whether it's Hong Kong, South Korea, Taiwan, Singapore, they all had a history of exposure to either SARS or MERS, right? They've all implemented alert levels, emergency preparedness techniques. So for example, when I teach, I practically had to switch over to online teaching overnight, but I didn't have to go and, vent on Twitter saying, oh my God, Zoom versus Hangout versus, blah, blah, because we already had systems and infrastructure set up. When the Singapore government said we moved to DORSCON level orange, everybody knew what that meant. You had interoperability of vocabulary, you had standards that people understood, you understand what work from home meant, you knew what stay-at-home notice meant, you knew what quarantine meant. Those were standard terms that everybody was, socialized to. So I think there is a lot of work around education, around preparedness that goes into this, so that when you have a pandemic, when you have any kind of public health emergency, you can actually escalate across and do triage, if you want to use a more medical term. And even Chinese walls that we have in law firms, or even the medical segregation that takes place of triaging serious, infected, non-infected, minor issues. All of those are measures that you can use without, necessarily seeing privacy invasions as your main attack surface.
Srinidhi, would you like to give us an idea of what we're seeing in Europe and what sort of changes, I mean, what sort of checks and balances do you think India can adopt or learn from?
Sure, yeah. So a couple of principles in the guidance that the European Data Protection Board has set out. So some of those principles are, of course, data minimization, collect only data that you need. For example, contact tracing doesn't necessarily require location, it only needs proximity data. So you don't need direct identification of individuals, try and avoid that. A very strict purpose limitation, purposes should be specific enough that you can exclude any kind of further processing for purposes that are unrelated to COVID. So avoid function creep. Same, deletion after use. It's a temporary solution for a particular problem. Don't use it for other purposes later on. But I think most of all, what European authorities have also mentioned is sort of data protection or privacy by design. Factor privacy in your assessment of risks, and that includes transparency. In a couple of instances, they've also suggested, especially if you're implementing a tool which is considered high risk, which involves large scale adoption, or it's a new tech solution, or involves systematic monitoring, try and do a DPI, do a data protection impact assessment to assess and mitigate any kind of risks that might emerge from use of a particular tech solution. So yeah, I think that those would be my sort of core principles to apply.
Shweta, what would you like to see?
I'd just like to add to what Srinidhi said again with respect to the data protection principles. The EDPB obviously did a very good job, but the other thing that they mentioned, which I think is very important, is accountability. They said that it's very important for the individual before they provide data. It's very important to know to whom they are giving that data. Are you giving the data to your central government? Are you giving the data to your state government? Who is the exact data fiduciary in that case? Because only if you know who the data fiduciary is you know who to approach when something is going wrong. So that I think for me, oversight and accountability of the organization that is collecting data is I think very important, and also data retention policies. If data that you're collecting, if you're using it for after primary use is completed, if you're using it for any secondary use, are you ensuring that you're starting the entire notice cycle again, or you're not doing it? If you're not doing it, you are then actually I think the best way to do that is just anonymize data. But again, there are questions regarding how effective is anonymization as well. I'm aware of those conversations too. But so long as even people in the government are aware of those conversations, I think we will still be in a better position than we are right now, because just blatantly anonymizing data is also not is something that has been criticized. Because I mean. There was a case study about call data records that were collected during the Ebola crisis, and I think the research was done by Sean McDonald, where he said that the only way that they could actually get appropriate utilization of the call data records that they analyzed was to de-anonymize data. So again, we need to get into more intense technical conversations that I'm not equipped to have, but people who are equipped to have technical conversations around anonymization and utility should start having that particular conversation. So yeah, oversight, accountability, and data retention is something that is, I think, an important part.
Thanks, Shweta. Gopal, do you think we, to adopt some of these principles, or do you think we need a new law? Do you think the current laws that exist are sufficient? What do we need to do from here to West? Firstly, in your opinion, apart from what everyone else said, what else do we need to have in terms of checks and balances, and where do you think these need to be vested?
See, I think we do rethink about laws from time to time. There's an interesting 2017 bill to repeal the Epidemics Act, which is there on the chat. If you take a look, there's a link there, which talks about quarantining. It talks about specifically with reference to large-scale epidemics, etc. I'm not clear as to why that never came to be tabled and passed, but it's clear that we do need newer laws, which are going to be a little more wide-ranging, but we need to be careful about how we legislate. You can't have a multiplicity of laws. For example, in the Epidemics Act, you can't have a privacy provision. You need to have a separate privacy bill, as is the idea. And that's going to take care of scenarios where things are normal, as well as scenarios where things are exceptional.
So should the privacy bill have a separate section for exceptional situations? Is that the place for it? Because
I think
there's
so.
a clear
Look,
violation of privacy that's taking place, and
Yes.
I mean, what we're trying to do is figure out some middle ground between an all or nothing situation. Because if you have a privacy bill, you have all, and in the current situation, it seems you have nothing. So
Yeah.
should the privacy bill
Well,
define what a
so-
government cannot do during such situations?
Well, Nikhil, I think it's a question of timing, right? If COVID had hit us in 2022, we might have had a Privacy Act in place.
Yeah.
So I think many people have said this, that we have to get the institutions in place, which means you get the laws in place, you have single answerable individuals for each thing in place, whether it's for health epidemics, whether it's the case of an aggression, whether it's for privacy concerns itself. You need institutions in place, and that's where we're lagging behind. We don't have institutions in place. Should the privacy bill be the place for making those provisions? Yes, because if the privacy bill is supposed to take care of privacy concerns, it needs to contemplate every possible situation that they can conceive of at that point of time, which is what I think 12 does to an extent. You know, it says that the data that is taken can be processed without consent in those kind of scenarios, and it mentions an epidemic if you're talking about COVID. But I think,
but in that sense, 34 exempts the government. So I'm not sure how 12 helps there.
no, that's taking of the data is one thing, and then of processing it, right? So when you've taken the data and you're required to follow the procedures under 11, 12 overcomes that. Now, in a situation like an epidemic, and remember, we're talking about a bill, right? So this is all going to be debated. It's coming back from a standing committee. So I don't know what the final form is going to be take. But as far as positioning is concerned, yes, the privacy bill is the place for it. If you're going to have a privacy law and it's not going to take care of exceptional situations, then as a citizen, where do I turn to for my protection? Because they will say, look, we don't have any other protocols for this purpose. So we are going to bring in the Epidemics Act, or we are going to bring in the National Disaster Management Act. Then the question will arise as to which law will prevail between these, right? So, and that's something that happened with Aadhaar also, if you recall. There was a question of the Aadhaar and the IT Act and how they played off each other. So you had to look at which was a non-obstante clause and which was overcoming the other, etc. Now, all those things will have to be borne in mind at the drafting process. But I just want to address one thing that I think both Malvika, Raghavan, and Shweta mentioned about privacy not being a luxury right. I think everybody here on this panel agrees it's not a luxury right. But what are you going to do about the mindsets of the people who are in the saddle, who are going to control these debates and these discussions, and what they think of it? Remember that if you consider the fact that over 2,000 FIRs have been registered across this country for people who have violated the so-called lockdown, while they were just trying to get food, while they were just trying to get home, and petitions were filed in the Supreme Court saying, look, please stop the registration of FIRs on the most unfortunate of us. And those petitions weren't even listed for being heard. I would say that when you consider the fact that your liberty is at stake and you could be jailed, when you don't have access to food and you don't have access to health, and those are concerns which in many ways, without us being adopting a paternalistic notion of what privacy is, in many ways for the person who is likely to go to jail, he may be willing to make a trade-off between these two rights. I agree, there's no question of making a trade-off. These are both crucial, important, inalienable rights. But what do you do about the mindsets of the people? When you say, how do we go forward? A, we create institutions. B, we try and change mindsets. We have to change the mindset that privacy is a luxury right. What I was saying is we are up against that barrier every single time. And the third, I think, which is very important, is constant vigilance. We have seen Vrinda telling us about the litigation that she's battling in Kashmir. Let me tell you what my fear is, that if 5 months down the line, we have 26 million cases of COVID across the country, and different states are trying to show that we are doing a great job of controlling this, but they can't control it as long as social media is putting out information and data. Remember, we don't have a single central non-governmental agency which is collating data on patients, on autopsies, on information regarding how many are confirmed or not. We're all getting it from governmental sources. So if tomorrow the government feels that there's a lot of misinformation going out and they activate the Telegraph Act and they cut off all our modes of communication, including this, then where are we? Because they're going to be, this is something that you need to be vigilant about. I feel that in a given situation where it can become quite extreme, this is the worst case scenario. It shouldn't happen. But if they've done it in a couple of union territories, they can do it elsewhere as well.
Okay, we're sort of running out of time, Gopal, but thanks for that. I'm just going to go to Vrinda Bhandari, Rahul Narayan, and Divij Joshi next. Also, Divij, when you speak, if you can also go into some of the dismantling provisions from both a technology perspective, what can we do there? And for the others also, if any of you want to go into that. Vrinda first.
Sorry, I was on mute. This is just in response to what your question, Nikhil, was to Gopal, when you said, oh, but Section 35 exists and the government will still have an all exemption. So what is really the point of Section 12? I think there is still an importance in both of them, because Section 12 will allow for non-consensual processing of data, which means everything else, all the other obligations of the Act will apply. To invoke Section 35, the government would have to then very clearly say that this is a national security issue. So, I mean, I do think that may be an impediment for the government to make that express claim, because Section 35 then says that you are exempt from all the obligations under the Act if it's a case of national interest of security of the state, sovereignty of India, integrity of India, public order. And so, then it would have to meet those tests, which might be slightly harder to make. Unless they make a case that a health emergency is a public order emergency, which may not necessarily be easy to make. So I think hopefully that the Act would at least prevent the government from really exempting themselves from all the applications because of law enforcement purposes.
Vrinda, what checks and balances would you like to see?
In any law, I mean, I think everyone's sort of spoken about it. I think a sunset clause is really important. I think proportionality proportionality is really important. And like I said, not just like a suitability test, like is it actually necessary for solving this purpose? Is it the least restrictive measure? And what is the balancing that you have to do? And what are the rights and obligations on other sides that you have to consider? And I think a purpose limitation test is really important. Finally, I think accountability. And so, I think someone pointed out on the group chat that the Arogya Setu app says that the government is not liable for any, for any misuse or something like that, right? And so the question is, who is responsible? Who is accountable for any misuse? And so that's why you need either a data protection authority or someone or an ombudsman whom you can go to and say, look, there has been a violation. Asking people to file writ petitions in court is not a sustainable solution.
Okay. Rahul?
Okay, I've actually been making a small list just in order to save time as to what are the checks and balances which I would like. So that's probably a quicker way to go about it. One, of course, I mean, this is again what many people have already said, and I think I would only be reiterating much of the same. The first is, of course, time. This is very important because there has to be a sunset clause, as that is correctly pointed out, and that's the way exactly how these things normally work in the rest of the world as well. There should be a purpose limitation, of course. There should be a kind of limit on sharing of data. And this is something which is very important. It's a standard common law principle which applies across the board in England, unless removed by a statute, is that when data is collected compulsorily for one particular purpose, by one particular department, it cannot be shared with another government department for any reason unless there is a warrant or some such thing. Now, this is a pretty important principle. I think it comes from a judgment called Marcel versus Commissioner of Police, which in the Chancery Court in the early 1990s. And I think we try to bring it up in Aadhaar, and I think we also send it to the Kenyans. I hope they bring it up in their judgment. It's a really important principle for government sharing of data. It's not that if I give my data to the Department of Health, it should that the police department knows exactly what's going on, or the taxman, because this would encourage, for example, people not to share data. And I guess we've been talking about government departments and trust, and I think this is an important way to go about it. A fourth point would be, of course, like I was saying earlier, shared decision making. If the decision making is broad, I mean, if it's like a team of rivals, so to speak, like for example, let's say, I mean, in World War II, Churchill had also Clement Attlee as part of his cabinet. If, for example, the decision making authority which could decide everything in this country will be comprised of people of different political views and perhaps maybe people of different states and the union, it might increase the national purpose behind it. It might encourage people to do a little better. A fifth point, of course, a very important policy of data deletion. This is extremely, like I said, I mean, you have to get rid of this data. Remember, I think maybe the answers to all of life can be found in one of the Batman movies. This is The Dark Knight. Remember where I think this guy had this massive collection of everybody's phones in the whole city. And eventually that sort of self-destructed, which actually is probably the best solution. Chris Nolan is a god. And anyway, then we come to oversight, which is again very important. Like somebody who mentioned Kato Reagan in the South African court. I mean, a kind of ombudsman, or like Vrinda was mentioning, or perhaps a judicial authority with actual teeth, that sort of thing would be enormously helpful. And again, like I said, as far as the declaration of emergency is concerned, or the continuation is concerned, let it be parliamentary and let it not be executive. The executive can make decisions, but this ability to lift you see, what is important to consider here is that the normal parliamentary procedure on everything, the normal procedure of federalism has gone, and now one central authority is deciding everything. In order to make sure that happens, let there be constant parliamentary oversight. I think otherwise we might as well just be hungry, you know, and I think that we will soon discover that the illiberal democracy soon no longer remains even a democracy at all. Like if Orban can pass whatever decrees he wants and parliament says, wow, you're a god, and do whatever you feel like doing, that's wonderful. But that's surely not the way we do things in India. That's not the way we should do things in India.
Okay. Malvika, what would you like to see, I mean, in terms of checks and balances, and where should those checks and balances be placed?
Yeah, I mean, I won't repeat the ones that have been picked up. I think the things that haven't been maybe stated on the institutional front, I think, is things like the PCLOB that they had in the US, Privacy and Civil Liberties Oversight Board. This is even for people who are, you know, whose personal data is being accessed for law enforcement. Can you have a body that's set up, which could later become the Privacy Commissioner or our DPA, which actually checks off whenever these kinds of, when there's a large information handling program? Because information handling is just one part of this pandemic. And clearly the issue is that people who are thinking about it have not been trained in any kind of data protection issues, right? That's okay. And it's great that they have external experts like Rahul speaking to them, Rahul Mathan speaking to them. But the point is, who in government has that accountability? And I think we can come up with a commission right now and set it up with, you know, standing committee of parliament or something that is actually has the accountability right now, and shift that to the DPA later. Couple of other things that I didn't hear mentioned were also, can we have kind of any kind of interim and ex post measures? Because along with the sunset clause, like, so one of the things I'm really concerned about is this pandemic is now a health pandemic. We're looking at an economic crisis later. So there will be other moves by government to use the information that's not just from the app. So I would like to map out across government what personal information is currently being leveraged in this pandemic for the health crisis, and kind of try and ring fence it a little bit, so that in 6 months later, when we're trying to target something somewhere, we at least there's a clear rationale why we're accessing this data. So I think, can we have a kind of ring fencing inside Parliament? It's a wish list you asked me for, in terms of the personal data flows that are currently happening to deal with the health crisis. Many countries do have it actually, so I'll put some links on that. We don't currently know what is being accessed and what is not about us, and that would be helpful to know.
Okay. Divij?
Thanks. I think my number one priority, like something that I would really, I really think needs to be implemented immediately, is incorporating a principle of non-exclusion or non-discrimination in the way that we're using these applications. This is not, you know, something that's new. Both the proposed legislation in the UK as well as the actual legislation in Australia that's been implemented a few days ago incorporates a principle of non-exclusion, saying that no one shall be harmed if they don't have access to a technology. No one shall be denied, you know, as is being proposed in India, access to food shelters or night shelters simply because they haven't downloaded an Arogya Setu app. And particularly important for going forward and implementing, you know, immunity passports, which is something that's also happening in India through the e-pass kind of Arogya Setu e-pass program. You know, we need to ensure that there's openness in the way that these decisions are being made about whether someone is healthy or whether someone deserves to be mobile. And that principle needs to be one of non-exclusion and non-discrimination. My second point, of course, I think that it is, and we should all as a community push for a temporary legislation. I don't think that the PDP bill is going to be forthcoming within this time And I also don't think that it's intended to be used in emergency scenarios. And I don't think, because it's impossible to predict what kind of information you might require or what kind of safeguards you might require in an emergency. And that's the nature of emergencies. So I think that we need to push for the kind of temporary legislations that are coming up in other jurisdictions. And we also need to, it needs to be very carefully constructed. And we think, particularly as lawyers, we need to kind of hopefully give input as to what that temporality means, because as the Supreme Court has held, and in Krishna Kumar versus State of Bihar, temporary legislations are construed from case to case. And it is possible that even if you implement a temporary legislation, the effects of that can carry forward after the legislation. So when we're drafting sunset clauses or whatever it is, we need to ensure that construction is well made. And also, I don't think that privacy policies are helpful to the extent that they give you some information about what's going to happen potentially, but without open protocols or open source app design, by default, privacy policies have never been challenged in court in India. No one's going to file a class action because we don't have a suitable structure for filing class action suits against privacy policies. So we need to understand the limitations of what a privacy policy can actually do for either dismantling or handling our data. I think so. What's important to focus on is technical and legal design. Within technical design, and to move on, as you asked me to address, how do we dismantle this? The most important thing I think is to focus on minimization. Make sure that only the necessary information is collected. Make sure that
but Divij, at this point in time, it's hard to determine what is necessary, right?
I don't think it's that hard. I mean, if you're doing contact tracing, then contact tracing is not new. I mean, it's existed since the bubonic plague, that you go and you figure out who someone has contacted, and if you think that it's a rapidly spreading disease, then you quarantine them or give them the information that they need to quarantine. Again, we need to stop this assumption that all data is helpful in all scenarios. Big data and AI and all this hype is ultimately going to distract us from really important principles of universal access and going to lead us down this rabbit hole of classification and discrimination, which is not going to be good for our society ultimately. So yeah, I mean, minimization and decentralization are two principles that I think have already been embedded in various technologies. And I would point to, I think, within my reading of it, at least, the DP3T protocol that's come up from a bunch of privacy experts in the EU is particularly interesting. And I think it's also been lent on by the Google and Apple kind of protocol that they're coming up with, which kind of, because decentralization kind of builds democratic trust, right, in the user itself. It says that if you want to volunteer your information to the central government for your own, benefit, then you may choose to do so. But if you don't want to, we're only going to give you the information that you may possibly be infected, and therefore, you can choose to take any action based on that information. It's not something that says that, if you download this app, the cops are going to come to your house and then arrest you. And I think that
Which
decentralization
is kind of what happened in Bombay as well, right?
And it's happening in a lot of places. I mean, there's a very clear link between the technological solutions and the policing system. And that's because our surveillance system is heavily embedded within our policing systems. So so in terms of technological design, I think decentralization and minimization is helpful. Anonymization, if you're sharing with the central authority, is helpful to a certain degree. We've had ongoing conversations about to what extent is anonymization really helpful. There are kind of mathematical limitations on, which balance anonymization and utility of any information. But as far as Arogya Setu goes, we don't know what kind of anonymization techniques they're applying. The government has used anonymization as substitutable for de-identification.
Which I'm going to have to ask you to wrap up.
So yeah,
we're running out of time.
And finally, I think, we should really be pushing for temporary legislation on this. Either it could be an ordinance, since Parliament doesn't seem to be in session or in any hurry to return to it. We could, pass an ordinance which makes specific temporary provisions and sunset clauses into it. And finally, I think we need to kind of resist norm changes in terms of what's happening. We've seen after 9/11, after 26/11 in India, that you have changes in the way surveillance is perceived or national security is perceived. Over here, I think the most scary thing I'm seeing is operating system level or platform level changes, which Google and Apple have been proposing. And I think that, it's something like saying that this is a good time to break all end-to-end encryption. That's something that we need to kind of be resisting and making sure that technical design by design is limited to a specific time.
Okay. Gautam, what would you like to see?
So my points have pretty much been covered by Rahul, almost like word for word. So, I mean, I don't think I have anything to add. It's all been said. Yeah.
Okay. Anirudh?
Yeah, thanks. I just wanted to bring out, I think, a few aspects to round off this discussion, and they might be slightly tangential to what we've been talking about, but I think they're relevant to discussing the norms that should govern us in emergency situations. I think the first is, and someone had raised this on the chat as well, the role of private bodies and what manner in which they'll be providing assistance to the government. I think there's the role of people like Google and Apple in designing the instruments that are used, but there's also, I think, private bodies being roped in for enforcement at the local levels. So there are reports of Suraksha Samitis and volunteer groups being granted almost police-like powers in Madhya Pradesh, or in Delhi, you have resident welfare associations sort of taking on this, the responsibility of ensuring that lockdowns are being followed and social distancing measures are being followed. I think there are questions about the competence of these bodies to do these things. I think there's also this sense that power does operate a lot more ruthlessly at local levels. There are questions about the particular motivations that these individuals might have. So I think in terms of if you're deciding norms for how behavior during emergency situations should be conducted, I think an important aspect of that is ensuring who power vests in and what accountability they have in these situations. The other aspect is, I think, the question of what resistance to infringements of privacy looks like in these situations. Because I think two things are true. One, that contact tracing might be helpful and that it requires a collective opt-in in order for it to be efficacious. And also that the way in which governments are doing contact tracing, either due to capacity or due to design, is likely to be or probably suboptimal and infringes on the privacy of people. Gopal had already mentioned how courts might be unwilling to step in and intervene in these situations. And in that context, there is a fair bit of chatter about sort of not installing the app as a sign of resistance to privacy infringements that the app creates. I think there needs to be a discussion about what would be legitimate resistance in this situation, because my sense is that a response which refuses to opt into contact tracing measures might be a dangerous response as well. So I think these are two aspects of how we govern our behavior during emergency situations. I think in terms of dismantling, and this is just the last thing, I think what would really help in order for advocacy towards dismantling any infringements that are made in this time period is sort of a tangible marker of when the emergency may, or the situation of emergency might be considered to be over. So Malvika Raghavan, I think, said that this seems like an interim period where we're holding fort until a vaccine, and a vaccine might be the one tangible marker that exists for advocacy on dismantling to really begin. But I think we do need to consider other markers that are maybe not as definitive as a vaccine, that might be good sort of milestones at which advocacy for dismantling can take.
Okay. So just anyone else wants to just jump in? Any comments? Smita, do you want to add anything that we may have missed?
I think we've discussed a whole range of problems and solutions here. So I don't know.
Anything from laws that were passed post SARS, Smita?
I think, Nikhil, the main thing that we need from that perspective is what I would say is that so while we have this exception under the PDP bill, right, assuming that that's the form in which it comes into effect, it's one exception to it's basically just a ground for processing the data, but that doesn't clearly solve for all of the other problems that we're talking about in terms of guiding how privacy considerations need to be taken care of. But at the same time, like I mentioned earlier, we do have plans in place for disease surveillance, for epidemics, for other situations, for health related issues, right? The problem, I think, is that those laws are clearly not updated to account for forget privacy, for just the use of technology, of the use of data at scale at all. So these plans, as far as I can tell, have been in effect for have been evolving for at least 20 years now, and in the context of disease surveillance and health care in India, right? And in the past 4-5 years, there have been actually, they've been developing a platform for healthcare providers to use in these contexts and things like that. But the laws, as we've discussed, have not evolved, have not changed at all. So we clearly need to update, not only, we do definitely need a privacy law, but we clearly need to update our other legal frameworks and our regulatory frameworks, considering overall as well how much we're focusing on digital governance in India. Like Malvika mentioned, I think there's going to be an there's going to be economic crisis or issues next, and we'll see a reaction to that as well. And there's again going to be a lot of emphasis probably on the use of data for this. But as a last comment from my side, at least, what I would want to say is that as a community of people who, we all know each other's work, we all know each other. We've all been working on privacy for several years now. But this conversation, the points that were raised about how this is beyond a privacy issue makes me think that we need to also focus on sectoral aspects of privacy, right? The big deal, the reason the PDP bill, the Personal Data Protection Bill, is such a big deal is that it's going to apply across sectors and across the country. So it's not, and that's the level at which this conversation within the community of people who are researching or advocating for privacy has been at. But we probably also need to start moving into more sector-specific issues, whether it's health. Clearly, there's a lot to be done in the healthcare sector, but also the financial sector. Barring Aadhaar, probably we haven't really had that kind of in-depth research or discussion on these issues. So maybe that's one big takeaway for us as well from this situation.
Okay. Thanks, Smita. I think we're bang out of time. We're actually more than half an hour over time. But thank you all for joining in. We will be publishing, this is being live streamed, but we'll also be publishing suggestions, which I hope will make their way to the government. And we'll be preparing a report for the committee as well, that's looking into the privacy bill, because I think what's on top of their mind is about how, is the privacy bill going to affect or prevent government action in these situations, and how and what are the alternatives? I think for me, the post-COVID scenario is going to be, I think, a lot about dismantling. But thank you all for being here. Really appreciate your time. We hope to have more conversations like this. And I'd really like to thank CCG, the Internet Society, Google and Facebook for the support for this discussion. We are going to be hosting more what we call public interviews, where we invite folks to listen in on interviews that we are doing. The other thing is that we're also, Medianama is going to launch subscription very soon, because we've been impacted by the situation pretty badly as well. But I hope you all sign up. So thank you all for being here. Thank you.
Thank you. Thank you.